Good morning, everyone. My name is Grace Whiting, and I am the President and CEO of the National Alliance for Caregiving in Washington, D.C., in the United States of America. I am so excited to spend this morning with you for day 3 of the World Carers Conversation, a virtual summit on the state of caregiving in the era of COVID-19. This is the middle of our ongoing conversation about what friends and family caregivers or carers are facing as we grapple with both the global pandemic and the recovery effort. You're welcome to follow us not just here, but also on our Facebook page. And those of you who are watching live, we encourage you to submit comments, questions, thoughts, and ideas in the chat box or on our Facebook feed as the day progresses. You can also participate in online conversation using the hashtag on Twitter, World Carers. Now we're going to go on to the next slide, and I want to tell you just a little bit about today's program. I'm very excited for the focus of today. Yesterday, we started things with a conversation about caregiving in North and South America. And we heard perspectives from Debbie Harris, a caregiver who is experiencing challenges with COVID in her own life. We've also heard this week from Cameron Janes, a musical artist who is a caregiver to her child who has a rare disease and her husband who has the same rare disease. And she kicked us off with some music and talked about what it is that really brings us all together. Today, we'll be talking about caregiving in the Middle East, Africa, and Europe. We'll be hearing again the lived experiences of real caregivers, as well as from global experts around the world. And we hope that as you engage with this conversation, that you'll share with us what you found helpful in your regions of the world. Finally, I will just mention that this webinar is being recorded and the recording will be made available. So if there are folks who would like to tune in, we'll be happy to post that to the World Carers Conversation website, where you'll be able to find all of the presentations, the recordings, and the background of our fantastic speakers today. So we're going to kick things off with what we're calling a fireside chat. Following that, we will hear a panel on caregiving in Africa and the Middle East. Then we'll move on to the lived experience of caregiving and what it's like right now for those who are grappling with this. And then finally, we'll end the day on caregiving in Europe, followed by some closing remarks. I also want to just take a moment to thank our sponsor, Embracing Carers, which is an initiative of Merck KJA Darmstadt, Germany, which in the United States is known as EMD Serono. My colleague Jasmine Greenemeyer from Embracing Carers will be participating in today's event, as with the other events this week, and she will be providing some closing comments from her perspectives, not only in Embracing Carers, but also in her initiatives related to healthy women and healthy economies. So with that, let's move on to the next slide. I want to tell you a little bit about our two wonderful speakers this morning. So first, it is my honor to introduce Lenny Shallcross. He is the Executive Director at the World Dementia Council. Prior to that, he was the head of community engagement, leading programs across the United Kingdom to establish dementia-friendly communities. This includes the Dementia Friends program, which is the biggest health social movement campaign delivered by 10,000 volunteers. And this campaign has recruited 2 million individuals through community, digital, and corporate partnerships. Before working with the Alzheimer's Society, he also worked in the UK government as a political advisor at the Department for Culture, Media and Sport and the Department of Health, as well as working in Parliament and for the Labour Party. And I should mention that here in the United States, we have taken a lesson from the World Dementia Council and implemented a Dementia Friends USA program. So just a wonderful example of what we can learn from each other. I also want to introduce to you Stacy Jimenez, the Executive Director of Eurocarers, which is a European network working for and with informal carers. Eurocarers brings together 73 organizations from 26 different countries, and their collective efforts aim to ensure that the growing care needs of the European population are addressed in a universal and equitable way, and that the vital contribution of informal carers is valued, recognized, and supported. Stacey is a trained journalist with experience in EU policy and communications. Over the last 17 years, he has acted as a project, advocacy, and communications director in organizations supporting the implementation and reinforcement of EU policies in the areas of freedom of the press, social equity, children's rights, development, and health and social care. With the Eurocarers Steering Committee, he sets the direction of the Eurocarers Network, develops and oversees the implementation of the action plan, and he is responsible for the Eurocarers Secretariat in Brussels. One final housekeeping note before I pass it over to Lenny and Stacey. If you are following along and you would like to listen to the closed, not just listen to the discussion, but also see the closed captioning, you should have a button at the bottom of your screen for closed captioning, where you can also read a real-time transcript of the conversation. So with that, I'm going to hand it over to Lenny and to Stacey.
Thanks a million, Grace, for your very kind introduction. I must say, it looks like I just came out of my picture. You know, I'm wearing exactly the same clothes. So good morning, good afternoon, good evening to you all. I'm not quite sure where you are all located, but I must say I'm really excited to be part of this event and this conversation with Lenny. Good morning, or good afternoon, should I say, Lenny. We prepared for this conversation last week together. We decided that I would kick off the discussion. And maybe if you agree, I think it would be maybe interesting to say a few additional words about the respective work of our organizations. I must confess that until last week, I myself was not really familiar with the work of the World Dementia Council. So, you know, would you say a few words about that?
Sure. So good morning, afternoon, evening, wherever you are, all of you. I'm here in London, so it's on the verge of being afternoon, but not quite. And talking to Brussels is probably, for those of you who follow the intricacies of European politics, is something we've been doing a lot of and plan to stop doing here in London. But at the moment, we remain part of Europe, which is rather pleasant. So it's great to be here. As you say, the World Dementia Council was set up by the UK government on behalf of the G7 following a summit that was held here in London in 2013, at which the international community made a series of commitments around how they were going to improve research, care, awareness, and risk reduction in dementia, and they set a number of goals that they would deliver by 2025. And the role of the Council, of which there are 24 members from around the world, supported by a number of governments, the OECD and WHO, and the European Commission, is to monitor progress against those goals, to report on how the international community is doing, and make recommendations on how progress can be accelerated. So it's a sort of, caring forms part of the challenges that we face, but everyone who has dementia will at some point have caring needs. You know, dementia describes a range of different diseases, the most common of which is Alzheimer's, but it is fundamentally, with a few exceptions, a degenerative disease that makes you more reliant, first on informal care and then on formal care.
Thank you, Lenny. As I told you during our preparatory call last week, you know, I think it's extremely interesting to have a specific focus on dementia, because I think dementia is a perfect illustration of what it actually means to be a carer and how difficult it can be on a daily basis. I must say we often use dementia as an example of that in our presentations. Maybe just a few additional words about our work. from Brussels, but across the network in 26 countries, as Grace mentioned. So our mission in a nutshell is to be the voice of informal carers, caregivers, unpaid carers, family carers. I mean, there are different names, but we're essentially speaking about the same people at European level. And we are part of a dialogue with the European Commission since 2014, which we like to say, or we like to see as a recognition that informal carers should be part of the conversation, that they play a central role in the provision of long-term care in Europe. Well, as a matter of fact, according to some EU estimates, as much as 80% of long-term care is provided by families, friends, neighbors. And so since then, we've been in this, conversation with the Commission, and we are consulted on a regular basis, not only on questions relating or to care and caring, but by extension to all the policy areas with a direct bearing on on carers, like work-life balance, access to employment, access to information and training, youth issues increasingly, because young carers are still by and large invisible. And so I think, when looking into the details of your work with the Council, I think we have a lot actually in common in terms of, certainly in terms of the message. I was also interested to see that your strategy, if I'm not mistaken, also builds on the WHO strategy on dementia, which includes a specific objective on carers. According to that objective, by 2025, again, off the top of my head, was it 75% of countries should provide training and information to dementia carers?
Yeah, so the WHO commitments came out of the London Dementia Summit. So that was one of the core delivery mechanisms that the international community identified to make progress, and it included a number of separate strategies, including around carers, which WHO has launched, but also the creation of Global Dementia Observatory that is acting as a repository of statistics around dementia. And I agree with what you said around how dementia can illuminate many of the challenges that face all carers. And that's because there's a sort of assumption that wherever you are in the world, the person with dementia is sort of elderly, housebound, unable to participate in society, kind of very dependent upon medical care, essentially no longer part of their community. And this is just not true anywhere. So, there's a study done in the United States that suggested, 4 in 5 people with dementia lived in the community. In the UK and Europe, there have been studies that suggested it's slightly lower. Most people with dementia live in the community. Not everyone with dementia is old, like there's early onset dementia. So when you talk about people who are providing care for someone with dementia, you are, as you just said, there are children who are caring for their parents, and those children might be 50, they might also be 15. Like, you find all examples of that. And at the same time, and particularly an issue in Europe, is that the assumption is that the person with dementia is roughly middle class, is white, is generally reasonably well off, is in a relationship and has a partner that's able to look after them. Lots of this is actually untrue. There are lots of challenges around the BAME community, Black and ethnic minority community, around the impact of poverty, around the kind of living in rural communities and providing care there. So I think wherever you look at the challenges of dementia care, you can see that reflected in challenges around care more broadly. And as you say, you're kind of advocate for informal care. There will never be a point, I think, where someone with dementia is not reliant upon informal care of some variety. Lots of people with dementia are still able to participate in the community, with informal help. They might need a companion, they might need support, they might need help getting from home to a venue, but they can participate. So there will always be a need for informal care in the dementia space. And what has often been missing is that governments have not recognised the extent to which, if you support the carer, you can keep the person with dementia well out of hospital and out of residential settings. I think if you had set a strategic goal for this space in dementia, it is that to enable people to choose where they live, whether in their home or in a residential nursing home, for as long as they are able to do so. So you do not lose your agency or your freedom just because you have dementia. And that means you have to provide support for informal carers. And many of the challenges that people with dementia face, psychological, physical, financial, social, are applicable across all carers, I think.
I think that's a very important and a central message there. And again, a common point between our two organizations, because this idea that it is essential to support carers and it is a win-win is at the core of our message. The only proviso maybe I would add to that is choice for carers is also extremely important. Obviously, we need to make sure that people who get involved in caregiving have chosen to do so in the first place. And unfortunately, the data at our disposal shows that in a majority of cases, of course, it is not the case. People become carers because they feel it's their duty to do so, or because simply the available services are not of a good quality, or are limited, and that leads to a very high prevalence of caregiving. I was wondering, this sudden interest by policymakers in the topic of dementia and caregiving. How do you see that? What do you think was the trigger? What was the turning point?
So, as Grace said in her introductory remarks, my background is politics, and there is a view of kind of, very, particularly actually when talking to people in the United States at the moment, given everything that's happened there, has been kind of upending most rules about politics. But in general, politicians follow the public. People think all sorts of things about politicians, but what they're very good at doing is finding out what issues bother the public and ultimately looking for solutions to address those. And what you have seen, and you will continue to see over the next couple of decades, is for lots of very good reasons, as we've been able to keep more people alive through surviving heart attacks, through reducing the number of strokes, through treatments for cancer, which means half of people will now survive cancer. And I think they're actually just testing the alarm here. So I will keep going through that. I don't actually think there's going to be a fire alarm, but more and more people are living with dementia. And what that does is pose huge fiscal challenges to most countries. So 1 in 3 people born today will die with dementia. Born today will die with dementia. So this is, and what we cannot do yet is slow or stop the trajectory of the disease. So the only things we can do is provide support and provide care for people. That will change over time, but over the next 20 years, before these treatments arrive, they'll slowly arrive in the next 20 years, we will need to continually provide care. And actually, I think that one of the policy challenges, and you'll hear from Emily later, who's done a lot of kind of advocacy around care in the UK, but is that when you address dementia policy, sometimes the kind of the challenges that face carers are put in the too difficult box. And we can do lots of things that are relatively easy and cheap and nice, you know, raising awareness and talking about communities that are friendly and support people, all of which are good. But actually what people need is help getting out of bed, you know, and without that support, then they're unable to participate in society. And I think that there's something in the dementia space that sometimes we don't highlight sufficiently, which you alluded to, is that dementia is a lottery. There is pretty much, there's, you know, you can reduce your risk of getting dementia, but fundamentally, a third of people will get dementia. Like, and it's just a lottery. You do not know, although we will eventually know, whether that's you. And that means it's not just the person with dementia, but a third of people are going to find themselves forced into providing care because they just do it. And like, I'm a great fan of lotteries if I ever win one. Like, I'm quite happy with Euro Millions. I'm all for that kind of lottery, but I'm not for a lottery that is about like your entire life will be upended because just by chance you end up in a relationship, or your parents end up needing care, or your neighbor ends up needing care. So when we talk about providing support for informal carers, it has to be situated under an umbrella that says, ultimately, our view is this is the responsibility of the state. Like, it is, we will never get away from informal care, but fundamentally it's the state's responsibility. And you look at different outcomes across Europe, which, you know, you're much more confident and knowledgeable about than me, or you look at different outcomes around the world, and a lot of it is what kind of financial support the state provides, what kind of respite support the state provides, you know, what kind of like state provision for carers to keep them well. And I think that we shouldn't kind of intellectually or emotionally accept that this lottery means that for some people, they will spend their retirement or spend a significant amount of their working life or even spend their childhood providing care, because that should not be how we organize things.
Absolutely, completely agree. And that's, again, that's at the center of everything we discussed with the Commission and national regional public authorities. I must say, back in 2014, when we started that conversation with the Commission, the narrative was along the lines of, we recognize that carers play a central role, but we simply cannot afford for them to continue in that role because, you know, there is a high cost in terms of employment, growth, productivity, and particularly female employment, of course, in Europe. And already at the time, we were trying to make the case that, you know, it's a question of striking the right balance, really, between formal and informal. Yes, it is primarily, and it should be primarily, the responsibility of the state to make sure that everyone has universal access to good quality care. But it's going to be extremely difficult to achieve that without the contribution of carers. And I must say, at the beginning, it was really difficult. You know, the Commission was kind of reluctant to support that message. And then the turning point, and that's that's kind of what I wanted to highlight with my question to you. The turning point was a report published by the, let's say, the equivalent to the finance ministry at European level. So let's say the department within the Commission dealing with finances. And they published a report where they, in 2018, where they showed that if we were to try and replace informal carers by care professionals, that would cost, basically a second long-term care system. So an increase in the share of GDP devoted to long-term care of 130% on average for the EU. So completely impossible. And then suddenly, obviously, the mindset changed, and that partly explains why a growing number of governments and regional authorities are now paying attention to carers. And the challenge for us is really to help them strike that balance, the right balance. And the way to put it simply, The cake should be formal care, professional care. The cherry on top of the cake which is essential, should be informal care. As it stands, the cherry is bigger than the cake. So we need to change that. But the two are essential. But it's not an easy win, because I think the devil is in the details, and and there is a tendency to hand over more and more responsibilities to families by recognizing them and creating a few limited support measures here and there, just to say, oh yes, we do recognize carers and support them. So that's the danger, I think, for our community, at least in Europe, in the years to come. Now, the key question now is COVID. How will that change or accelerate the shift? How do you see that?
So it's interesting that COVID in some ways has been a global experiment in the impact of social isolation on individuals' health. And in one aspect of the kind of the challenges of caring is social isolation, removal from community, etc., etc. We've all experienced that. And that's highlighted something that people have said, which, depression is commonly associated with caring, in part because it upends your ability to participate in life. Whether COVID has long-term implications for how policies are delivered, far less clear at this point, I think. I mean, the point to make predictions is not necessarily in the eye of the storm. You can see this playing out two ways, one of which is that over the next 6 months, significant numbers of vaccines get delivered across Europe. The world breathes a sigh of relief and moves on. However, I think for governments, one of the things it has highlighted is, and particularly in Europe, the US, where you have this huge level of hospital level data and an ability to pull levers, but they've not been able to do that across the formal and informal care sector. So people just haven't known what's going on. Like, it's been much more difficult to deliver PPE. It's been much more difficult to deliver testing systems. It's been much more difficult to know, like, even the impact that policies are having. While you can kind of monitor who's coming in and out of hospital and you get live data, there are huge data gaps that have been highlighted by this. And I think that's one of the important things, because I noticed in the chat, so Liam poses the question of, does the panel have a view on the language of caring? And it appears across Europe that there are different meanings and understandings of the term. And I think that it's almost like caring happens in a hyper local situation, and it's difficult to know what's happening at a national level, and it's difficult to make comparisons across Europe, and it's difficult to make comparisons internationally. And if there was one thing that came out of COVID that would over time make a significant improvement, I think it is the collection of data on what lived experience is like. And from that, you can do better research, you can do a better dissemination of research, and you can build the kind of collaborative international partnerships that you see in biomedicine. So in this era of awfulness that we've gone through, there is an opportunity to make things better for carers, I think.
Yes, they say never waste the opportunity of a good crisis. Yeah, no, again, I agree with you, and that problem was obviously pre-existing the crisis, but the crisis really shed light on the lack of comparable data, at least when it comes to social care and long-term care and the situation and needs of carers across Europe. As a result of COVID, what we're seeing is that suddenly a few members of the European Parliament, for example, are paying attention to that and have contacted us, and we're working with them to see how we could maybe help them formulate a proposal in that regard to encourage the Commission to propose something, hopefully a legislative kind of initiative on the topic. I know the Commission is also involved with member states, but I mean, And as I keep repeating to my British colleagues and friends, I'm convinced myself that all of these developments and ongoing policy dialogues when it comes to care and caring ultimately have an impact on other countries across Europe. We have quite a few members, in non-EU countries like Norway, Switzerland, and now obviously the UK, unfortunately. And we see how, ongoing discussions at EU level also have an impact on their work in terms of research, in terms of access to funding, in terms of the buzzwords that suddenly their policymakers are, using. So I suppose we need to remain optimistic in the sense that there's quite a few things happening that were already initiated before the crisis, and now the crisis is, fueling that process. Obviously,
sorry.
No, I was going to say, obviously, in terms of the negative impact, it's also extremely clear, and colleagues from the UK, I'm sure Emily will say a few words about that. The data collected by Carers UK, for example, is really striking in terms of the severe impact of COVID on carers who are in first line. I think the most important aspect of that is the new population of carers, because I think that could also have an effect on policymakers. If now suddenly this new population, who presumably will also start, making their voice heard about their new situation and their needs, that could also make a big difference.
Yeah, it always struck me, when that politically caring has never had the impact proportionate to needs. So for so many people provide informal care in one form or another, so many people, and so many people receive it, that you would have thought it had much more political resonance than it does. And I think there are lots of reasons why that's never really been the case, partly, and I think some of them are psychological. We just accept it, but we've kind of slightly framed this in a kind of, particularly when we were speaking about formal or informal care earlier, is that actually people want to provide informal care, and it's a positive experience. Like people want to care for their loved ones. They want to look after their neighbors. They want to be a good friend. But this is not. It can be a very negative and very unpleasant experience for people, and it can have a terrible impact on their health and their own well-being as a carer. But equally, people do find it positive, and they do want to look after their loved ones, and they do want to provide support. And I think that's one of the reasons why there will always be informal care. Like, we will never move away from it. You want to look after your family, and that's a great thing. But what it shouldn't be is that, it's just shoved over and see you later and come to us when you've got hospital needs. So, and I'm not sure the extent to which, forever hopeful that it will become a kind of big political issue in that sense, because people are in some senses happy with it. Now, the thing that we need to continually highlight, I think, is that if you want to keep people out of hospital, if you want to keep people out of residential care, which will save the state a significant amount of money, the costs of hospital admission is huge, the cost of residential care is huge, then you have to keep people well at home. And to keep people well at home, you are going in some way to be reliant on informal care. And I think that that's, in a sense, of what you've advocated at a Europe level, of some a strategic approach to delivering care, is where governments need to get to. They need to see how addressing care will enable them to deliver health objectives that provide long-term financial benefits to society. And it's it's kind of not after the hearts and minds of politicians, it's after the wallets. But there's a very good reason to do this. So I'm forever hopeful that we will get there. I think the best thing that we can do is to get, and post-COVID, is to get better data, to collect better data, to share better data, and for the care community, you know, initiatives like this, initiatives like yours, to collaborate much more internationally, to do, as you say, share knowledge, share ideas, because you've seen how that's advanced science rapidly, and you can do the same here.
I completely, again, yeah, and absolutely right. And I think we should never forget that, as you rightly said, caregiving is part of the human experience, and there's an intrinsic value to caregiving in terms of social cohesion, solidarity, intergenerational solidarity, particularly in a, you know, rapidly aging Europe. But at the same time, yeah, I mean, I agree with you. Policymakers tend to have a bit of a cynical approach to the issue, in the sense that they see caregiving as a barrier to growth and productivity and employment. And the big change in recent years is that they've come to realize that it's just impossible to meet all of the, you know, the growing needs of an aging population without carers. So they came to the conclusion finally that we need to strike that balance. So I suppose my conclusion is, yes, there's hope at the end of the tunnel, but we need to be careful, and probably we can join forces to achieve those goals.
Yeah, I think that is a very good note. I realize we're coming to the end of our fireside chats when neither of us have ideas, but that's a very good point to end on, because will things get better? Yes, they will. Will it take advocacy and championing of it? Yes, it will. Is there hope? Sure. Is there a challenge? Sure. But can you do this? Yes. And on that note, I think I say it's great chatting as ever, and everyone back to Grace.
Wonderful. Thank you so much. We are so honored to have had you both. And Stacey, your comments about caregiving being just a human experience, I think very, very helpful and inspirational. So we are now going to transition into our first panel. And while we're doing that, I would encourage you to share what you're learning about on Facebook, on Twitter. We have some folks following along with us on Facebook and on our other social media sites. Charlotte, if you want to go ahead and put up the panel, I'm going to tell you a little bit about who is joining us today. So if you're just now joining us, I'm Grace Whiting from the National Alliance for Caregiving. And this is day 3 of the World Carers Conversation, a summit that we're hosting in partnership with the Embracing Carers Initiative. So today I am very excited to introduce this next panel, which will be about caregiving in the Middle East and Africa. And the panel today will be led by Rachel Ledany, who is a passionate social entrepreneur and who transformed her own private life experiences as a caregiver for her husband into a nonprofit organization to put Israeli caregivers at the top of the agenda. Caregivers Israel was established in 2014, and it's committed to raising public awareness of the caregiving phenomenon and its personal, social, and national impacts. Rachel works with Caregivers Israel, and she, in that capacity, has developed impactful cross-sectional relationships that yield the establishment of policies for caregivers in the workplace, promoted research and academic involvement, and established online support and counseling centers to help thousands of family caregivers. She's also been engaged and the catalyst behind a powerful caregivers community in Israel during the COVID-19 crisis. Caregivers Israel has helped to bring the community together to lead to unprecedented support for thousands of caregivers in Israel through the adoption of digital tools. And Rachel's background is in psychology and organizational counseling, and she is the chair of the Strategic Projects and Communications Committee of the International Alliance of Carer Organizations, and they are a full member of IACO. Our second speaker today is Iseng Awa, who is a project manager in the Department of Social Policy and Intervention at the University of Oxford. She works on the development of Parenting for Lifelong Health Digital, a digital version of the in-person parenting program. She also leads the dissemination of the COVID-19 parenting resources in West and Central Africa. Her research interest includes social issues and literacy, especially in developing countries and poor communities around the globe. She has a PhD in education from the University of Cambridge in the United Kingdom, and she also has degrees from Harvard University in the United States of America and the University of Uyo in Nigeria. And then our final speaker, which I am just thrilled to introduce you to, is F. Akosua Ajimang, who is a professor and researcher at the University of Ghana. She focuses on social gerontology, aging, and community development. And she's also co-authored a wonderful paper on long-term care for older adults in Africa. And she has come into our community through our colleagues working on global partner engagement at AARP International, which is headquartered here in Washington, D.C. So we have a wonderful panel, very excited to hear from you all. And with that, I'm going to pass the torch on to Rachel to kick off this discussion.
Okay. So good morning, afternoon, or evening, everyone. Thanks so much, Grace, for your warm introduction and for initiating this important event. I think this is an excellent opportunity to speak, share, and learn from experts around the globe. Like we heard before in the fireside chat, that was eye-opener. We come from different places, but it seems that we, as people, as caregivers, as leaders, share mutual needs, dilemmas, challenges, and hope for a better life for caregivers. And in this extreme period that we are experiencing now through the COVID pandemic, this event reflects me that we all have also mutual responsibilities to raise the voice of caregivers, support them as being essential partners in care. I'm honored to moderate this panel with two brilliant women from our region that will soon share their wisdom. From the point of view of my country, of Israel, the pandemic was an accelerator in terms of numbers, challenges, and opportunities. In 2019, there were 1.2 million family caregivers in Israel. According to the latest survey that we and the Brookdale Institution initiated with inspiration and help of CARES UK, and thank you, Emily, in the first lockdown in May 2020, we have almost now 1.5 million, 260,000 new family caregivers joined this group. They are more stressed, they have more financial problems, and they need more information and guidance in decision making. Caregivers Israel, the association that I lead, made a quick response through digital webinars and support services for the caregivers. We worked with employers from the private and public sector to support their employees, that most of them, like everywhere else in the world, moved to work from home. We did, and we will continue doing our best. But most important is that the pandemic reflected us, the reality that caregivers in Israel are not recognized nor supported enough by the government. And this was our opportunity to raise awareness and demand more official answers from our leaders. And as a result of those efforts, in March 2020, a cross-sectoral team was established in response to the COVID-19 pandemic. The team works on behalf of the Prime Minister's Office to promote recognition and support services for family members. This is the first time, and I'm so excited about it, because this is the first time that such a broad collaboration of government ministries has been established to discuss the issue of family caregivers. 7 ministries are participating, and representation from social sector organizations like JDC, Caregivers Israel, and Myers JDC Brookdale Institute. We serve as expert resources. The team is focusing on 2 key issues. The first one is simplifying the family caregiver role by making relevant information accessible and recording the caregiver's name in health and long-term care records so that they become recognized, an important source of information and support. The second one is making accessible existing solutions in the field to support and assistance to family caregivers, to strengthen their resilience in dealing with the important and complex tasks they perform. During the second lockdown in September 20, and hopefully we don't have a third lockdown, this team, we published a special guidelines for family caregivers for the first time. I can promise you that we will continue bringing the evidence and building a stronger caregiver community that will demand their rights. I really hope that we are starting a new period as the vaccine is already here, and that 2021 will be healthier and safer for all of us. Now I'm honored to give the stage to Isang Awa from the Oxford University. Please.
Thank you, Rachel. Hi, everyone, and good day. Thank you for joining us today, and many thanks to the organizers for putting together this summit and for the opportunity given to me to present our work. I'm part of a team of researchers who, under the leadership of Professor Lucy Clover at Oxford University, has developed different resources to support parents and caregivers. And in my presentation today, I will briefly discuss the increased challenges that parents and caregivers have been faced with since the onset of COVID-19, as well as our response to these challenges. Ordinarily, parenting is challenging, and in the context of COVID-19, the challenges have only increased. With the lockdown, school closures, restriction of movements, every family in the world has struggled to care for their children. Parents and caregivers were suddenly thrust into the roles of teacher and round-the-clock caretaker, and this while still doing their regular jobs. And that's not all. The impacts of COVID-19 on parents and caregivers include loss of income, loss of livelihood, food insecurity, illnesses, lack of medical supplies, a looming debt crisis, and security risks, and much more. And sadly, but expectedly, all of these have led to increased stress, fear, financial worries, anxiety, and escalation of child abuse. I know that today's panel right here, this panel is centered on COVID-19 in Africa, Europe, and Asia. So I think it's important for me to mention here that the harmful effects of the COVID-19 pandemic have not been distributed equally. Impacts have been most damaging or are most damaging for those in the poorest countries and those already in vulnerable and or disadvantaged circumstances. And even though the prediction of high fatalities in Africa turned out to be a false alarm, the effects have been more severe in Africa than in other regions. And the already discussed impacts of COVID-19, the impacts I have mentioned, have been higher on caregivers in Africa. The next slide, please. Thank you. So in response To the challenges faced by millions of parents worldwide, our team, the Parenting for Lifelong Health team, quickly partnered with many international agencies, including the WHO, UNICEF, Global Partnership to End Violence Against Children, World Without Orphans, and other organizations to develop resources to support parents. These resources are open source and evidence informed. They are based on over a decade of experience of implementing parenting programs, and they come in simple language with clear affirming messages. You can see one of them right here on this slide, take care of yourself. We also have other similar messages, that these are tip sheets, and they also come with colorful illustrations that make them appealing to people everywhere. We have a total of 15 tip sheets, each one with a different message. Like we have one on spending quality time with your child, another one on parenting in crowded homes and communities, another on parenting children with disabilities, another on family budgeting in times of financial stress, and so on. In addition to the parenting tip sheets, we have tips for case workers. You'll see some of them here, or you'll see some illustrations on the slide rather. We have tips for case workers, public service announcements, radio scripts, social media toolkits, and even paths for religious leaders, because we know that dissemination work can be done much faster when we involve religious leaders. And in addition to these resources, we have Parent Chat, which are online parenting groups. We have Parent Text, which essentially is the delivery of free parenting text messages through phones. What is fantastic about this is that the messages can be delivered through smartphones, and on basic phones. So people everywhere, even in rural communities, can receive these messages too. And last but not the least of these, we are developing a parenting app, which will be evidence-based, open source, and even though developed for caregivers in developing countries, will be accessible to caregivers everywhere. So we are working on a parenting app in addition to these resources that we have. The last slide, please. I'm sorry this slide is so busy, but there's just so much to share about the work that we are doing. And I'd like to say that the dissemination of our COVID-19 parenting resources is primarily done through partnerships with international agencies, governments, and local implementing partners. In Africa, we work with various local NGOs and civil service organizations who use various channels to disseminate the resources. Where needed, we support the implementing partners in various ways so that the resources can be used in their own context. For instance, the parenting tip sheets have been translated into over 100 languages. And we also we do trainings and workshops. Right here on this slide, you can see a few specific channels that our partners have used in the dissemination of these resources. In South Africa, in Zambia, in Malawi, Zimbabwe, millions of people have received the parenting resources through the radio stations there. In Namibia, the resources have been shared through the Office of the First Lady. You can see some of the things I've written on the slide. In Cameroon, they've been used in workshops for fathers. And in Kenya, they've been integrated into mHealth messages. These are bulk messages that are sent out. And these are just a few examples. Also in Kenya, Safaricom uses the COVID-19 parenting song as a ringtone. This is a lovely song with a nice catchy tune and beautiful lyrics that affirm parents and encourage them to slow down. If I had the time, I would play it for us, but I want to encourage you to look up the song on YouTube. It's titled, Let's Slow Down. And it's been very exciting to see the reach of these parenting resources. Presently, we have reached over 134 million people globally. And in Africa alone, over 23 million people have gotten these resources. We have also received many heartwarming stories of how these resources have helped caregivers and their families. These stories remind us that there are people out there in great need of parenting support, and that we need to continue in our efforts to support caregivers. We know how important it is for caregivers and parents to be physically healthy and emotionally well. And so we will continue to support caregivers with resources even beyond this period of the pandemic. You can read up more about our COVID-19 parenting resources on our website. The website is on the second slide. And please get in touch with us if you would like to know more about our work or partner with us in our work of supporting parents and caregivers. Thank you for listening.
Thank you so much, Isai. It was so impressive to realize the complicated needs and your services and the scale of services and the impact on so many people. Very impressive. Thank you very much. I'm honored to invite Akosua.
Good morning, good afternoon, good evening, depending on where you are. Yes. My name is Dr. Akosua Agyeman. Please, can you move on to the second slide? Yes. Basically, what all of us are discussing is almost the same thing. And when you come to Africa, it's almost the same thing. The challenges, everything that we are talking about is the same. So I'm going to focus on Ghana and then adults or older persons, because I've seen, when you read the literature, you realize that a lot of information about caregiving are on children. There are so many policies regarding what should be done to children and so on and so forth. And so during this COVID, a lot of things were done, especially in Ghana, for children. They were not going to school, they were in the house. Parents were there taking care of them and all that. But realize that if you look at the vulnerable groups of people that we have, about 5 of them, older persons and persons with disabilities are part of them. And so during the COVID, we were expecting that whatever is done to the children to take very good care of them should have been done to older people. And so there was the lockdown that we all know. Ghana, for example, we entered into the lockdown and people were in the house. And so socioculturally, it altered our behavior a little bit, because we mostly are in the informal caregiving system where children or family members, friends, churches care for older persons and then also give care to children as well. But during this COVID, everybody was kind of afraid. There were a lot of fear, isolation, abuse, and so on and so forth. So people were not able to go to the next home to work. We don't have the formal system where caregivers are trained to go in and then at the end of the day, they are paid. It is the family members, the church, the friends that give care to either children, older persons, or persons with disabilities. So when that happened, we were not able to go out. Everybody was afraid. And so these older persons were in the family. Now, if you happen to have children around you in the home during the COVID, then they can sort of be around you. And so you might not enter into the loneliness. They were not also able to go to even to the health facilities where they can get health care. And so a lot of things happened and there were lots of agitations in terms of what should I do? People were afraid, especially the older persons. Children were being educated through the social media, TV, and so on and so forth. The older person, their way of getting information was either by watching or by listening to the radio. Those who did not have it, because in Ghana, we have about 75 to 80% of our older persons residing in the rural communities. And so when they don't have these radios and TVs, it became a bit difficult. So they didn't even know the protocol that they were supposed to go through. And we did a study in Accra. Accra is the capital city of Ghana. And there's a location or an area known as Ashaiman. And when we went there, even how these older persons should put on nose masks, it was difficult because the younger ones were not coming close to them to sort of teach them what they must do. And so we saw also that there was education was a bit lacking in terms of the population, adults, those of our adult population. Education in terms of the COVID protocols was lacking. So we had to, anywhere we go, had to, chip in a little bit and pieces here. Now, when you come to Ghana, as I said, or in Africa, just as my sister said, there are gender, differences in terms of caregiving. Society expects females to behave in a certain way and males to also behave in a certain way. And we have grown to experience that females give care a lot, either to children or to adults. And so they were afraid. This thing was a little bit, was not working to the fullest. And so if you look at older people currently in Ghana, the caregiving is in a deplorable state because even before COVID, the care wasn't too good. Because as I said, we don't have, policies in place like we have in the European or the Western countries as the children have in Ghana. So a lot of things were, done haphazardly. The aged really were not, cared for properly. It is the extended family, as I said, caring. But today, every child is going to school. And so it becomes very difficult for somebody to stay in the local communities and say that I'm going to care for my grandparents. So it became very difficult. But whether it's difficult or not, there's still need for care. Now, here in Ghana, there's non-policy on welfare of people. The children, as I said, enjoy a little bit, but in terms of older persons, it's slow. And social change has altered our cultural values. Urbanization, westernization, globalization, so many things have come and have changed so many things, which is also giving a strain on the family, a strain on their psychosocial, beings and all that. And so the older persons feel very abused. They are in poverty because they are no more going to work. They don't earn salaries like they used to be. And even those in the local areas, their situation is a bit pathetic because if you're not a cocoa farmer and you don't have the cocoa farm to share with others, then it means at your age, you'll not be able to function very well in your cocoa farm. So it becomes very difficult. Even if you have children who will send you money, the children will be there to send you money, but when they are ready. If they are not ready, it means they cannot share with you anything that they have. And so in terms of disasters like the pandemic that we are talking about, the care of the elderly became a problem. They were there alone. Some of them were in isolation, and they will tell you when you go to online YouTube, we did a program with Atinka TV, is there. They shared a lot of experiences with us during what they went through during the pandemic. What about the persons with disabilities? They are with disabilities, they are old. What happens to them? And then their human rights, sort of, in quotes, were also a bit abused because we are in COVID. I will not come and visit you as a grandfather or a child. And then you call me, oh, you too, why? Why are you worrying me? Don't you know that we are all afraid of COVID? And they themselves, the older person, were even afraid for people to come close to them because they think that caregivers who will be coming to take care of them, even family members, may bring them the COVID-19. And so they were afraid and wouldn't want anybody to come close. And they were also not going close. And so some of them, the moment they hear that, oh, my colleague is dead out of COVID, then they are also afraid and will be crying, thinking that they will also die when they contract or the disease, because they thought that that pandemic or the COVID virus is for older persons who were above a certain group, let's say 60, 75, 80, then it means automatically once you have a headache or once you are sick, you are going to die. Please, the next slide. And so these are some of the things that, so the caregiver, the one going to give care to this person, needs respect and appreciation and encouragement, because at that time, we needed to encourage people to give care. People were afraid to give care and assistance and support to, older persons and even children. And so we needed to encourage them and to appreciate what they were doing. If you look at the health personnel, the government came in to just appreciate what they were doing. And the government also decided to give water and some amenities free so that people can be free to go and then take care of whoever they have to take care of, especially with the COVID patients, and then the health personnel who were giving care to other people, children, and then the older persons, for them to go. Otherwise, they would have said that, me too, I will not go, for me to, contract the disease or the virus. And so not everyone can take up the role of supporting or assisting people. And therefore, anytime that we have people supporting us, we should be able to appreciate them so they can do more. Now, the reason why I'm saying this is that in Ghana and in Africa, the caregiving roles that we play are not paid for. I have a question: should caregivers, informal caregivers, be paid? We don't have professional caregivers. We have the informal caregivers. And so when they do that care, how do we pay them? How do we encourage them to go on and do whatever they are supposed to do? Because we take them as friends and family, we don't do much. Even sometimes when the care recipients receive the care, thank you becomes a problem. We don't even appreciate what they do. And because of that, some of them are very unwilling, especially when we are staying at home with a help that will, cook for you, help you with activities of daily living. These our older persons will not appreciate. And when that happens, they also feel very reluctant to give care. Now, way forward, my previous panelist said it, that we need to collaborate, because both adults and children, all manner of people, require caregiving. And so what we have to do is that we need to collaborate with external, carers. We need to collaborate with NGOs. Here in Ghana, NGOs are working when it comes to the area of care. In the COVID pandemic, Center for Aging Studies, we were able to get some food relief items. And then we have stakeholders who are NGOs also into the care of older persons. And so we managed to group the people, and then we're sending the food items from the government to them. And so when the government partner with caregivers, with patients, with the NGOs, non-governmental organizations, civil society organizations, together we can make it work. And even when all of us, like we are doing now, African countries, Western countries, everybody comes together, we learn from each other. What are you doing that is working for you? What are we also doing that is working for us? Then we come together, come to the table, draw one plan, and then we can move on, depending on your cultural setting. Because some of the things that are done elsewhere, you cannot replicate that in Africa. You need to look at the cultural setting before you can do A, B, C, D. So when we all come together, we can share ideas and then bring about change. And also population, as I said, is increasing. Children are being born every day, per second, every day across the globe. And so they're also growing to be older persons, and therefore they will need support. And so we need government also coming in strong to bring us some policies that can help take care of either older persons or the children. As I said, NGOs everywhere are into children. A lot, anytime I have the chance to speak, I ask this question. It's children. What about these older persons? I think we need to talk about it. And also, if there's free health care, purposely for older persons, we have the national health insurance, but it's scattered. It's not purposely for older people. So if we're able to get a provision, a policy that is just towards the older persons to enhance their caregiving and uplift some of their burdens, it will go a long way to help with the caregiving roles, and then they also taking care of themselves. Then the caregiver, though the one that gives care, what do we do to them? And it's a question I'm throwing: should we pay them? Non-formal, informal caregivers, should we pay them? If we should pay them, who should pay them? Is it the father? Is it the mother? Who should pay them? And so these are some of the things that I want us to, judge about and see how Africa can also be helped. Please, the final slide. The final slide, yes. And so actions that we can take as far as carers and caregiving roles are concerned, we need to respect whichever category of person that we are taking care of. The fact that the person is receiving care from you does not mean you can handle the person anyhow. So here they have human rights. We need to respect that human rights. And also help our loved ones to cope with the loss of independence, especially in the area of persons with disabilities and then older persons. They are independent, they have lost some form of independence. Let us help them to cope with that loss and then make processes of adoption and fostering friendly. In terms of children, when you come to Africa, we don't have the well-established homes like it happens in the West. And so though we have scattered ones, what is the care like? And so here, if somebody wants to even adopt, the process is very cumbersome. So we need to go to make it the process a bit friendly so that people who want to adopt and take these children to their homes or other persons to their home to care for them can do that. And then in all what we do, we should plan ahead. maybe in 10 years, what is going to happen to Africa? And now our population is 10. In about 10 years or 20 years, our population will be this. So we need to plan. It's just like the baby boomers, US in 1946, planned that in 60 years or so to come, these cohorts of people that are being born are going to age to this level. And they planned. Do we have that? So as Africans, we need to do that. And then keep our loved ones active. Example, in the older person that I have passion, we need to help them to be active. They are losing their independence, especially those who are old. I mean, 80 plus, we need to help them, be active by taking them out, exercising. It depends on the strategies that you put down as a carer to be able to help this person. And then keep eye on their physical and mental health. Sometimes if they need to see a doctor, send them there to see a doctor. And in the hospitals, we want to, plead and say that the medical personnel should not only do the medical model of healthcare, but they can also do the preventive aspect. And then geriatric centers, if it is open for the older persons, can also go a long way. Currently, Center for Aging Studies, we've managed to have one that we do Wednesday clinics, which is helping, though not too many people are benefiting, but we are starting from a small, a lower level. And then we have to discuss our finances with them because some of them make outrageous demands and we are not able to make it. So if you are a caregiver or a child to this older person or a child, try as much as possible to discuss your finances so that demands that is beyond you are not made. And then above all, we should consider a home caregiver to help the elderly or persons with disabilities or orphans and so on and so forth. And then we should also consider caring for our loved ones in our home. In Ghana and in Africa, as I said earlier, we don't have the institutions. If you come to Ghana, the few that we have are non-governmental. They are private homes. What is the government doing? If government can come out with an institution, like if you go to Sweden, they have all these structures there that you can send your older person to, or even if it's a child, children's homes are there. In Ghana, we don't have that. We have one for, and then some scattered private ones for children. But in terms of older persons, they are all private and expensive. And so people are not able to patronize. And so again, we must ease our own burdens to help us to ease our own. But sometimes adults and children must do things for themselves that can ease the burden of caregivers. And caregivers themselves try as much as possible to also care for yourself so you can give adequate care to those who need it. Thank you very much.
Thank you very much for your moving words and full of passion. I have so many things that I would like to speak with you, so many subjects that I wrote to myself during both of you spoke, but I think we don't have time to speak about everything. I want to speak on one thing, start with one thing, and it's about the gender differences. Before the pandemic and during the pandemic, and maybe we'll have to look about it after the pandemic is finished. You mentioned it a little bit, Akosua and Isang, when we speak about parents for children or for children with special needs, we emphasize the role of mothers, all the fathers, but we speak about it a lot. I would like to hear more. What is happening in your countries with this difference? I can say that in Israel, as we share the maybe same tradition families, we sometimes find that we have the serial caregiver, the woman that is not getting married, that is not getting educated, that is not having a career, and she is the caregiver of her parents and maybe of her uncle or her brother. And do you have something that you can share about how you deal with it? I will add that during the pandemic, the survey that we made in the pandemic, we found that spouses, women spouses are at the most at risk population during the pandemic to get stressed, sick, out of job, and I would like to hear your voice about it. Isan, can you share, please?
Sure. Thank you so much, Rachel. So I think like in most, well, even more common than in other places in the world, women in Africa are the traditional caregivers in homes, not looking after not just members of their nuclear family and their children, but even their own parents and their in-laws as well. And we have had experiences. So like, I'm going to cite a particular example that happened in Cameroon. So we, like I mentioned during my presentation, so we work with different NGOs and civil service organizations. And with a particular NGO in Cameroon, so there had been disseminating the resources, the parenting tip sheets we have to women. And they had a situation that many of the mothers were complaining that because of course with the lockdown and everything, children were home. So there was so much stress. And so the challenges that these women were faced with suddenly increased, and they were complaining that they didn't have the support of men. And so we had to do a training we first had to train the staff of this NGO on why it's important to get the support of men. And based on the training and the workshop that we gave to them, the support we gave, they went on and used our parenting tip sheets to run workshops for fathers in the community, which in a way, which went on to support the women. So we are also, and that's just one of the ways that we are getting to address this gender imbalance in homes, because traditionally, and of course, if there are recently, let me just mention this. I read a recent New York article in, I think, New York Times, that reported that more mothers than fathers have had to quit their jobs to stay home looking after the children and so on. So you find out that this is in New York, then you can imagine what would be happening in African societies. So when we talk about loss of income, loss of livelihood, women have been affected more. And many of these women feel like they are not supported. They're not getting the kind of support that they would want from their husbands or, from the men in their lives. So part of what we do is also, do workshops to show why we need to get the involvement of men. I hope that answers the question.
Yes, this is a very nice way of dealing with it.
Thank you.
We're in it together, men and women, so we have to be in it together. Akosua?
Yes, thank you very much. Just as she said, and in Ghana, for example, our culture plays a role in the situation where you have more women giving care than men, because we are oriented to understand or socialized to understand that a woman's role is in the kitchen. And so right from day one when you are born, you are oriented towards giving care at home, babysitting, cooking, sweeping, cleaning, and all that. And so we grow up to be that. Now, the men are not socialized that way. They are socialized to know that they are the breadwinners. So they go out there and bring food home. But society have changed now. Initially, you don't find more girls in school, but now we do, because of affirmative action that we took some years back, where gender activists went around to, educate people to understand what reason why girl children must also be sent to school. So we have a lot of girl children now in school, but we still play our cultural role as babysitters and all that. So just as my sister said, you may have a man and a woman married at home, and they've given birth to children. It is the woman that takes care. Some men don't even know how to boil water. When they boil water, it gets burnt. And so this woman will have to, even for her to get the husband off, will have to help this man to know how to, do ABCD, provided the man is ready to do that. And sometimes we tease them when they travel out and get to your setting, because your setting, women are not the only people that provide care. They do household chores and other things. When they come back to our country, it is the woman, so they don't do anything. So these are some of the things that it has been with us culturally for a very long time. And so it needs a gradual process and much education for men to understand that we all came together and made a family and made a home. And so both of us must be able to take care, not necessarily giving money, putting money on the table and say, go and prepare food with the money. No, but whatever affects the children, whatever affects our in-laws, both sides, we should be able to do it together. In one of our researches, we realized a woman who was even a teacher, the man sent the woman from where they were living and then sent the woman to his family. And the woman was the one taking care of her, his mother and his father, and her children as well. And anything that this wife does was not appreciated because they think that she's not part of the family, she's a wife. So do ABC. And sometimes when she's even out, working, she has to come back home, run from work back home so that she can do household chores to feed the in-laws, so she'll be accepted. And so I said, if I don't do, they won't accept me in the marriage. And one thing is that because in Africa, we cherish our marriages so much, nobody wants to be a divorcee. And so even if the person is dying, the person will still have to stay and take care because he doesn't want to offend in-laws or outlaws, so that they may say that he's not a good woman, so on and so forth. But it is time that all of us must realize that we make one family and we can come together and give support to our older persons and then to our children. Family support is key. Even in the churches, these discriminations are there. Sometimes the caregiving things or the prayer meetings and other things that are done in the church will raise people to know that you are a woman. So in some churches, the woman's corner, the women's corner is here, and then the men's corner is also on the right. So you don't even sit together because you are a woman. And so they're always playing down on women. And when that happens, it is difficult for us to get consensus when it comes to caregiving. When you get to the rural communities in the African situations, it's worse. Now that everybody is going and females are also going to school, now it is these older women who are taking care of older men and then children because they don't have any place to go. So it's a very difficult and dicey situation. And that is why we need collaboration and efforts from all angles to be able to make this caregiving, no matter the person at the center, work and work perfectly. Thank you.
Yeah, thank you. Thank you very much. I think it's really matters of are we have a choice to care or not? What about the education of caring and support for caregivers? Do I have a time for another subject? Because I just wanted to say, Koswa, you talked about being paid as a caregiver, and
Yes.
I want to tell you that just to share that in Israel we have paid caregivers, and we have in the last 2 years paid family caregivers. Family caregivers.
So who does the payment?
The government. The paid
the government.
Yes, family caregivers can be hired as it's new. It's only 2 years, and in the pandemic, it's the numbers are rising and rising. More family caregivers that lost their jobs, and because of the pandemic, chose to take care to be hired as caregivers and be paid by the government. It's very low payment, low income. It's like, but they have all the rights that every employee has in Israel.
Yeah, for Ghana and Africa,
it's not so
we don't
easy.
have that.
We can talk about it a lot, and I will be happy. I will be happy to share with you maybe even after, because it's very delicate thing when the caregiver, the family caregiver, is paid. So sometimes it has many other difficult in the dynamics of the family. That he has to do everything. Nobody is collaborating with him or helping him because he's getting paid. And it's new, and now it will be starting maybe to research it and to find out pros and cons. The last thing, you both are coming from the academy, And I was really thrilled to hear how you're very active in the field, and how you even promoted cross-sectoral collaborations. And I wanted to know if you have some tips for other academy people who are watching us, because most of the time, academy, we work with the academy in research terms. I think the opportunity to have the academy as partner to move this huge mission, it's a great opportunity. So I will love to have some short tips or some short from your experience of collaboration.
Maybe we can share that later after this meeting, because if I want to start talking about it, we might not finish. We might take this time, and it will not be
one sentence.
Important for us to share one thing here, for the benefit of others who may not have the opportunity to join us after this.
Yeah, for one of the collaborative activities that we do is that we have been able to bring a lot of non-formal organizations that are into, for example, into older persons. We've brought medical professionals together. We have non-social workers, because in Ghana, for example, doctors and the hospital staff are they are not working with social workers as you see in the Western countries. So we've been able to train some of them, especially residents that are coming now in the various hospitals, to accept social workers with them, because some of the ailments that go to the hospitals are not hospital or disease. It's not a medical staff. Some of them are social. So you need a social person to come and engage this person and talk to this person. And you end up not even giving any medication to this individual. So we've managed to bring all those on board, and we train them. In fact, those even that are in the homes providing, we call it house helps. We bring all of them together and we train them as to their relationship with the older persons and the children in the families that they may find themselves. So this is what is helping us, because we cannot go across the country to get the older persons, but then these stakeholders are there and we bring them, and we try to do a lot of research too with a lot of people. I have public health, persons that I collaborate with and write papers with. So they bring their, technical know-how to bear, what is happening in their field, what is happening in the medical field, what is happening and then together we bring all of them together, and then we try to put our, views across on paper, so that if whoever wants to use it and is beneficial will have to use it. So these are one way that we do. And even foreign collaborations, yes, we have exchange programs and collaborations with NC, Chapel Hill. We have people that we write, Zimmerman, for example. We have Greensboro, we have Sweden. We have so many other places, universities that we go to, that we collaborate with, so we can know what is happening over there. They come to teach, we go there to teach. And so we bring the African, experience to table, and they bring theirs to table. And then we put our heads together and come out with one common solution.
Great, thank you very much, Isang. We have little, can you share your wisdom about it?
Fortunately, there's not much I have to say, because she said the main thing there. The key word is collaboration. As researchers, we realize that our research can only be effective if we are collaborating with people out there, first of all, with the policymakers, because without their intervention or without getting them to make policies, to formulate policies that would support this, then there's only so much we can do. And we need to work out with collaborate with practitioners out there. I think it's a matter of practitioners realizing, or people in the field knowing that they need evidence, to support their work. And we realize at the same time that while we have this evidence, we need to collaborate with the people who are actually in the field. So it's a matter of a collaboration, which is what I essentially discussed in my presentation. We got the evidence-informed resources, and then we collaborated with NGOs, with CSOs, with people out there to get those resources disseminated to people who need it. So I think the key word is collaboration, partnership.
So I just say thank you, Grace, really thank you, both my partners here in the panel for your excellent words and sharing your wisdom. Thank you everybody for your time, efforts and engagement. I have to say in my personal words that I'm closing this panel with concern and more understanding of the urgent needs of caregivers in the Middle East and Africa, but with really more hope and confidence that together we can do it. We can do better. So thank you very much.
Well, and if we have one question from the audience I want to share because I think it's a great note to end on. Monica writes, do you agree that one of the main reasons there is more and more attention being paid to informal care partners at this time is that the women who have had to be both in the workforce and taking care of families are a new generation of women who have had a life experience outside of the home, and they do not want to be seen anymore as sort of an unpaid volunteer after having had experienced that professional life? And thinking of this panel, you know, distinguished academics and Rachel, your work as an entrepreneur, would love to hear perspectives from all of you as to whether you think that's what's driving some of the energy behind the carers movement.
Well, if I have to confess, what I would say to this is that yes and no, in the sense that I'm speaking from my part of the world, for example, whether you are a worker or not, you are still a woman. The baseline is that you are a woman, so you are supposed to give care. And that is what our culture expects us to be. Whether you are a new age woman or the old school woman, your duty is to give care. And so that is why there's a contention here that I go to work. I'm a woman, I have children, I go to work, my husband go to work, we have children. But when we come home, I still have to do most of the things at home. Unless your children are old enough to help you, you do everything and take care of your in-law that is staying with you. Here, you are not going to say that because you are a professor, because you are a doctor, because you are a politician, because you are, you know, a big man or a big woman in the society, you are not going to do that job. You will do it. And so what some people are doing now is that instead of, you know, it wears you down. And so what they do now is that if I'm out of the home, then I need to get somebody who will hold the fort for me, so that when I come, I have less work to do. And that is what the problem is again, because those ones that we bring to our homes to help us cater for our family, they are all also engaged in one way or the other. They are also going to school. Sometimes we don't have the institutionalized ones where you have agencies, so agency can bring you somebody. Here, when they are coming, it's informal. So maybe your auntie's child or your community member, she comes and the family members are like 3 years or 2 years. Send her to go and learn apprenticeship, maybe vocational skills or something. And so your hands are tight. Meanwhile, within that 3 years, you still need help. But you need to send this person out there to go and acquire some skill. So she comes home the same evening that you also come home. So then what have you achieved? So it is becoming very difficult to even hire. And now what we do, for me, I've been hiring for my parents, is that we get somebody who is a bit older, maybe has 1 or 2 children, and the children are old enough to take care of themselves. And then the person comes home, does the cleaning and everything, and goes back to wherever she lives. So you're not going to get 100%. And when I hire you, if it is 2 years, then at the end of the 2 years, I have to send you off and bring in another. And so we still, as academicians, as corporate women, we are still taking care, because you take care of the first child in your home, which is your husband, and then all the other ones come in. And then the peripheral ones, the extended family people come, you need to take care. If you don't take care of them, then you are, mistaken as something else. And so all these people come in, and fine, the things are changing now. Some of them, when they are coming, they will alert you, they will inform you, I want to visit you tomorrow. Will you be available? In most cases, it's not so. I'm going to visit my sister. So she takes his bag and off. So these are some of the things, that is happening. So no matter your level of education, you still will need, you have to do your chores and then give care. So you're giving care outside, you're giving care, at the periphery, and it is all part of our life, but then we need to meet each other in the middle and see how we can do all these things with it, because when these things happens, it places a lot of stress on the caregiver. The care receiver is okay, she's receiving whatever care you are giving him or her, but what about the giver? So the giver is psychologically, emotionally, socially stressed. Sometimes you don't even have time to fraternize with your cohorts, and it sometimes affects your work because you need to leave work, take some leave, and come and stay at home and take care of a sick mother or a sick relative or something. And so it's becoming a whole lot of that we need to come together and then see how far we can help, especially the carers, because if you are not healthy, you can't care for anybody. Thank you.
Absolutely. Yes, thank you for that perspective. I think more people share that experience around the world than it. I think it would surprise us how many people have similar experiences. Iseng, do you have any thoughts you want to contribute?
Yeah, so I'm not sure that I agree that one of the main reasons why more women, or I'm not sure I agree with the view that they don't want to be seen as unpaid volunteers, having experienced a professional life. I think it's more about realizing that I can't juggle, do everything, be looking after the family and still working at a career. And this is how much I can handle. The one thing I would say is that I think with the education, more women are getting more education now, getting degrees, higher degrees and so on, getting a career out there, professional career. I think that one of the things that that has done for more women, especially in the African context, is giving you agency and giving you a voice to be able to say, this is what I want for me, this is what is working for me, and I don't care if it doesn't fit into the role that the society has carved for me. I cannot be a traditional, look after everyone, my children, my family, in-laws and everyone, and still juggle, a career. So I'm going to get someone else to look after the family. So I'm not sure it's so much about, I don't want to be seen as an unpaid volunteer, but more like, this is not working. When I come home, I am tired. So if I have to pay someone, I pay someone to do it. In Nigeria, so I'm Nigerian, and I raised my kids. I got married in Nigeria, I raised my kids in Nigeria. I do understand in some, just like Akusa spoke about, we do have, there's the system that relatives can come to stay with you, but more and more we're shifting to this place where rather than get a relative, a cousin or someone to come stay with you, you rather pay someone you don't know. So it's very professional. It could be a live-in help. I had live-in helps when I was raising my kids. So it's a very formal arrangement. You get someone, it can be through an agent or it can be through a relative back home, but it's not about, it's more like, I can't do this. If I'm going to have to work outside the home, then I need a support system. I want to pay for this. We can afford to pay, we can afford to hire live-in help, or even if we want someone to come into the home, and then leave at the end of the day, then we can get that. And this is what works for me. So more and more people are getting to do that.
Thank you so much. Rachel, the final word is yours if you want to react.
I will summarize a little bit. I agree with both of my colleagues. I want to take it in another way of, in the time of the pandemic. I think that in one of the conferences, one of our leaders said, now we are all caregivers. We all understand what is caregiving, both men and women. And without speaking in feminism words and feminist words or not, I think that because everybody realizing now what do you have to or sacrifice or give from yourself, from your social work, from your work-life balance to be a caregiver. So that's why there is a great speaking with now about caregiving, because unfortunately, I think that even we are very strong women, maybe all of us, and we're juggling from place to place, and maybe we think that we are super women and everything. We are still expected to do it. And now I think everybody gathered at home. Everybody really became caregivers because of the elderly was in the lockdown, and we had to start realizing what are we going to do. So I think that it's now on the table more because of men are more caregivers than women, and this is our opportunity to work with this situation and this reality. And just to notice, we all know that countries that had female leaders made much better than countries with male. So we are okay.
Well, thank you so much. Thank you all. It was truly an honor to have all of you, and of course you're welcome to stay for the rest of the event. So thank you, and I'm extending a round of applause. I would like to introduce all of you to our next speaker, and I'm looking at my colleague to see if we have a slide for Aisling Harmon. And so so just to tell you a little bit about her, she returned to Ireland in 2006 to take care of her father, who had Alzheimer's disease. And she's now caring for her mother with advanced Parkinson's disease and dementia. She's retired from 17 years of osteopathic practice, where Aisling advocated for osteopathic accreditation and regulation within the United Kingdom, Ireland, and in Europe, lobbying nationally at the within her home country and also at the European level. Her background, having these transferable academic and clinical skills from practice and teaching, I think adds a unique perspective to what she's experienced as a family carer. She has a keen interest in the translation of research to policy and is regularly called on to represent the lived experience of dementia caregiving. She's also worked extensively as an expert panelist and speaker and advocate in places from academia to the not-for-profit or NGO sectors, and she's contributed to policy dialogue with public and state bodies. She is also a Dementia Carer Campaign Network advocate and supports an online family caregiver or carer support group with Care Alliance Ireland. She's participated in the Irish Patient Education Program in 2019 and plans to resume her postgraduate study that was derailed a bit by the COVID-19 pandemic. So I'm very excited to introduce you to her, and she's going to share a little bit about her experiences. So thank you so much for being here. We really appreciate it.
Good morning, Grace. Thank you very much for your warm and kind introduction. I'd like to thank National Alliance of Caregiving for the opportunity to speak to you all here today. It's actually a very humbling experience because I speak to you as a family caregiver. I'm not speaking to you with my professional hat on or a research hat or my clinical hat. I'm just doing what I hope was required and is to present the impact of COVID-19 reality on my life as a carer. I would just also like to acknowledge Care Alliance Ireland, who have offered wonderful support to me as a carer over the years and have guided me and so many other carers in Ireland, and their support and care is invaluable, and I thank them very much. Thank you, Liam, for that. I'm going to speak to you probably for about 12-15 minutes. I can talk for Ireland literally and metaphorically, so I hope I don't hear the chime and find I've got several other slides to go through. I'm also quite visual, so I'm just going to read off this slide and talk to you about my experience. So good morning, good afternoon, and good evening to all of our participants around the world in what's a fascinating and truly informative event. Okay, so COVID-19 reality, what it actually meant to me in my life this March. If I step back a couple of years or 3 years, I was diagnosed with an autoimmune disease, and that meant I find myself on permanent immune suppression, and I have degeneration of the joints of these poor old hands that have worked so hard on many wonderful, deserving patients for a long time. And so 3 years ago, I had to look at changing my career path. So I made a plan and I organized scaling down to part-time work. So my patient safety was looked after, my own recovery as I started long-term treatment was looked after. And also my needs for my parents changed. My father passed away in 2017 and my mum's needs escalated very dramatically with advanced Parkinson's disease, and she now also has dementia. So I've been officially an informal carer to varying extents for over 14 years, but actually my caring role started over 25 years ago with my family. And I have to remember to care for myself too. So I'd started this lovely plan and this lovely approach. And I had returned to postgraduate study and a master's in social research in Trinity College. I was really enjoying being a student again, feeling not as old as I am on paper. And motoring halfway through my year, scaled down my practice and retired in December, and also enjoyed the time I had as an informal carer with my mum throughout the week when I could sit quietly and study whilst she's looking after her daily tasks. She's rather non-verbal, but is still quite conscious and aware and has very distinct needs, but physically immobilized. So somebody must be with her pretty much at all times. And that's where I was going to. I had my plan in place and I was halfway through my year and my health crisis hit. I had an emergency surgery in March and needed time in hospital, needed emergency respite care. And then the 17th of March happened. So I'm getting ready for my surgery, looking forward to being okay again and having to take time out, and the pandemic hits. And overnight, 24/7 hours, overnight, my world was turned upside down. My world as a newly retired osteopath, my world as a postgrad student, my world as an informal carer, my world as a patient. My whole world was changed. My life space was diminished and really reduced to a very, very limited, close-knit functioning unit at the time. It meant that my caring role was also somewhat obliterated, or the understanding and the accommodation and the respect that I've been paid for my caring role was obliterated, as I was unable to bring my mum back home post-hospital. Initially after my surgery, I was being compelled to consider moving her automatically into nursing home care, which was not her choice. Her choice is to stay at home as long as it's medically safe for her and as long as I can accommodate that for her. That's her wish, which I wish to uphold. But also there are huge financial constraints on our family unit after my father had 3 years in nursing home after a 14-year journey with Alzheimer's. So we have spanned the whole gamut of what it is to provide informal care in the home for a very close, dear and loved one. And that opportunity and choice was removed from me overnight, and being very much compelled to consider nursing home care and not being given an option, and being judged extremely as being the outlier, as being the unusual person, as not fitting in with public health policy and with social care policy by insisting on keeping my mother at home. And funds were made available to subsidise and help move her into nursing home care, but they weren't going to be made available to keep her in extended respite for a few weeks for me. And that was rather disconcerting, I must admit. As things happened with the pandemic, our formal care workers who come into the house 17, 18 hours a week, many had to stay at home to mind their children and their own families. Some left and went into the nursing home situation because they were paid an extra few euros per hour and there was a desperate need for nursing home care. So they moved into that environment, and we lost our immediate support network among our formal caring staff and friends and common companions. They were gone from us. Their agencies had no replacements. And many went to the nursing home because they thought they'll have a 12-hour shift, they'll have fixed pay, they'll have fixed hours, because many families withdrew their formal care hours for fear of cross-contamination for COVID being brought into their homes. So that was another reality that we hadn't foreseen happening. And so I came out of hospital to find that actually we didn't have any formal care workers come and provide the supporting hours. And so my mother had to stay ultimately in extended respite for over 15 weeks. So my caring role was obliterated in terms of the formal supports made available and my ability to perform as an informal carer. And that was a very frightening reality. And it's one that hasn't fully recovered and gotten back to its previous situation. My postgrad is still incomplete. I can't return to my course because of the risk of subsequent lockdowns, which have happened, and because I don't have formal care workers sufficiently in place and funded to permit me to get back out to study. So I couldn't take that risk again. I face health risk myself as I'm immune compromised. So I have to cocoon with my dear mum. So we actually are the safest bubble to be part of because we're not at the supermarket. Despite having been in hospital on 4 occasions and despite her having been in respite care for 15 weeks, we've proven COVID negative time and time again. And we're not out circulating in our community. We're a very safe, protected little bubble, but we're cut off from other supports coming into us because of COVID risk. That poses risks to my mental health, which I think from my training and from my experience in life, I would have thought I was able to manage well and to look out for any warning signs. And having come through recent serious illness, I was recognizing I would need to take care of that. But this all happened at a time when society has locked down. And even though we have Zoom confirmations and consultations and support, it's not the same as sitting down and getting a hug from a loved one or a best friend or a family member, etc. So that immediate support network for myself has collapsed. The greater community disconnect, we have no daycare services. So we're 9 months down now. Could have had a baby in that time. Daycare services have not reopened. We don't have physio services coming to the house. So my mother's physical disabilities have advanced greatly, and she's perhaps deteriorated by 12 to 18 months ahead of time compared to how she would have been. So she can no longer walk now, for example. We no longer have a speech and language therapy available to us. We can't access our social worker. We have a wonderful public health nurse, and we do have an occupational therapist who's permitted to come in for a 12 or a 15-minute visit. So the bulk of the work now, with limited formal care hours in the home for those who are willing to come back in, and my ability to perform as an informal carer, my mum's needs are grossly reduced. They're not being looked after to my satisfaction or how they had been previously. And I'm very troubled by that because she has a finite time in which she can gain and benefit from that. And I don't have options. It isn't simply a case of throwing money at it to bring X, Y, and Z in. We're living in this lockdown environment or reduced lockdown where we have to be very careful about transmission of COVID. However, for other families and friends of mine where they were in similar situations and they chose to go down the nursing home route, many have lost their loved one and developed COVID whilst in a cluster in a nursing home. So our most vulnerable actually weren't protected brilliantly, despite that being suggested as the most optimal route. We're plunged into a financial crisis as a result of this reality, as I'm not returned to work, and I have to balance the number of hours I'm available to work or study, as opposed to whether I then qualify for a carence allowance or a support. I never expected myself to be in that situation, and my transition to my next stage of my career has been put on hold. So my ability to earn my income back through my own career is greatly threatened at the moment. And there have been no additional resources made available financially to those caring in the home, to informal carers. So whilst our formal carers were able to withdraw from work, and because they were giving up work due to COVID restraints, they received €350 a week. The family carer or the informal carer who might qualify for carers allowance receives €219. They had no uplift on that subsidy, and yet your additional costs for all of your medical expenses, doing everything from home, having to have everything delivered to the house, all of those costs went up without any support services. So we're actually in a financial crisis at the moment in our household as a result of that. So we've lost meaningful control of our immediate activities of daily living, and our prospects to expand that back into a previous reality are still controlled by external parties. And we must look out for public health, but our immediate internal health, both mental and physical, is still greatly compromised. And that life space as a carer and as a recipient has been grossly diminished. And so we're socially isolated still 9 months later, not expecting this to have been the reality. We don't have a voice as carers. Everybody is out and we're clapping every night for frontline workers, and we're acknowledging how hard they have worked. Well, family carers are the invisible workforce who haven't been recognised. So that's been my immediate reality, and I apologise that it may seem very negative, because I have survived through this. I have lost 2 friends who were nurses who died as a result of COVID infection picked up in hospital. And I have other family friends who, his entire family have been affected by a cluster and have lost a loved one. And I have neighbours who have grandchildren at university who've picked up COVID and are now suffering long COVID syndrome. So we've suffered bereavement directly and indirectly as a result of this, but life has been haphazard. So that's the immediate impact of COVID-19 on my reality of my life as an informal family carer. If you'd kindly move to the next slide for me, Charlotte, please. Thank you. I've learned some lessons out of COVID, and not all of them are negative. And I think it's very important as we come out of lockdown and try to look forward to learn from those lessons and see what we can do and move forward. This is our scapegoat, the COVID scapegoat. So Capra coronaria, I'd like to call him Frank after Capra. He's even got a little red, muzzle here and beautiful colouring from his corona crown. Survival of the fittest, I would have to agree to disagree with that. And some countries went with herd immunity and are disseminating their lessons or not as a result of the outcome of that. The most vulnerable weren't really protected particularly well. So they were put into nursing home environments or encouraged to go there. And then we had mass clusters breaking out in that. As society as a whole, if we needed to function and were allowed to go to work and couldn't work remotely, we might have been the fittest physically, but COVID doesn't respect that. Whether you're a young 20-year-old who's fit and healthy, or if you're an 80-year-old who's vulnerable and frail, coronavirus doesn't really respect that. The gap between formal and informal carers, well, that moral compass, as I've discussed in my first slide, became greatly challenged and is still challenged. And that's a widening gap. And it just brings it home to us that public health policy and social care policy is very much based on recognition of the formal carer route, and by lack of visibility of the informal carer. And as my work as an advocate on the Alzheimer's Society of Ireland Dementia Carer Campaign Network, one of our campaigns was literally a purple bubble saying, make caring visible. Dementia is an invisible disease in particular, and it needs to be made more visible. So our research and our funding priorities have perhaps also become more polarized as a result of the corona pandemic. So we have a rather utopian academic view on public policy and social policy review. We tend to aim for the perfect policy, the perfect piece of research before we go and implement that. But actually, for COVID research, in less than 12 months, globally, we have been able to mobilize hundreds and hundreds of millions, billions of dollars and of euro to come together globally and synergize and find a vaccine, find a cure. But informal carers look after people who have illnesses and diseases that don't have a cure and don't have a good prognosis. And we are truly invisible, and we are not being looked after or optimally served by some of the approach to social research, to public health policy, to social care policy. And as an informal carer, I'm quite angered by that now. Public and community and health policy disconnect. We've run out of excuses for why we can't look after our informal carers. We've heard this morning from a most magnificently diverse panel of other carers, of other academics, of policymakers, of people leading organizations who serve to support carers. And we will hear from more in the sessions after that. And we haven't got a decent enough excuse to explain how, for example, in Ireland, we can fund 22 billion over a 12-month period to make people stay at home and not go to work, to risk exposure to COVID. But informal carers who save the state 10 billion euros a year didn't get an extra €1 in their own family budget funding. We've run out of excuses to explain that. And so to me, the COVID pandemic has been a scapegoat for all of these reasons. If you kindly move to the next slide, Charlotte. Thank you. The other lessons that I've learnt about COVID is that it's been the universal whistleblower. It's blown the whistle on the lockdown. Well, the lockdown, welcome to my world as a carer. It's not particularly pretty at times. Has my life as a carer changed in pandemic? Yes, some immediate constraints were there, but the limitations of budget, the limitations of care options, the limitations of recognition, they are absolutely no different. So what it's done is it's given the rest of the world, the non-formal carer and the non-informal carer, an opportunity to walk in our shoes for a while and experience that. We've been there, we've got the t-shirt. We can give you a video if you'd like one. Zoom, connecting the person and the place. There's no excuse for carers, particularly informal carers and particularly dementia carers. There's no excuse now for us to be unheard. We have an equal share of the voice. Technology has mobilized. The world has gone online. Commercial business has gone online. GP practices have gone online. NGOs have gone online. Some support services are online, but not all care needs can be delivered online. And particularly for dementia carers, as Lenny Shallcross and Stacey Egamos referred to, not all of those can be delivered online. We need to be heard now. PPI and participatory research, this is the time. Hear our voice, engage us from day one in the scoping of research questions, in the design of surveys, in the data collection, and in the future dissemination. We own that information. We own the opportunity. We present the opportunity to deliver it. That's how you will affect change, positive change for informal carers in particular, in the social care environment, in social policy, and in public health policy. Informal carers are the invisible and the exploited front line. That's particularly disconcerting and inexcusable. There's a lack of recognition that we can no longer explain. And just finally, I would say, for global care recognition, this is the time. This is our window of opportunity to take this change. No two cases are the same. There's no bespoke model that you can apply. The role of the informal caregiver is superbly professionally delivered, is superbly informed, and is ubiquitously available with a little additional support. Thank you for the opportunity to speak to you today. Enjoy the rest of the conference. It's been a real eye-opener. Thank you.
Thank you so much. We appreciate your perspectives and you know, very moving, you know, to hear this sort of transformation of it sort of being hidden and then being put into the limelight with COVID-19 and then, but still not always being fully understood. So thank you so much for your perspectives and for being here. We appreciate it.
You're very welcome. Thank you.
So we are now going to move into our next panel. This has been such an exciting meeting. We've had so much that we wanted to talk about that we are not going to go to a break. We're going to just move right into the next panel. I'm going to encourage you, and I'm going to do the same here. I'm actually going to stand up and stretch, make sure we're getting that chance to walk around our house as needed. And then Charlotte, if you'll go ahead and put up the next slide. I would like to just tell you a little bit about the fantastic panel that we have. Again, if you're following online on Facebook, please feel free to share your comments, your questions. If you're watching live now via Zoom, you can also provide your questions and comments in the chat box or in the box marked Q&A. You can also look at the transcript, a live feed of the conversation by clicking the closed captioning button at the bottom of your screen. And as a reminder, this webinar is being recorded. This digital summit is being recorded, and you'll be able to access that recording on the World Cares Conversation site, as well as the Facebook page for the National Alliance for Caregiving. So I'm very honored to introduce this wonderful panel. Our moderator today is Jilpa Keithley, who was born in Guernsey, the Channel Islands, and trained as a social worker. And in 1986, she became chief executive of what was then known as the National Council for Carers in the United Kingdom, and led the carers movement for the next 12 years, creating the Carers National Association, which is now known as Carers UK, and turning what had been truly a private hidden trouble into a public health issue, recognizing the needs of Great Britain's 6 million carers and putting the issue high on the political and social policy agenda. Jill has held many chairing roles on government and other public service agencies. She is currently the president of the National Council of Voluntary Organizations and vice president of Carers UK. She is a former president of Eurocarers and has addressed many national and international conferences about caring agendas. She was raised to the peerage in 1997 and sits on the Labour benches in the upper house of the UK Parliament. She's a very active working peer specializing in health and social care issues. She is also a deputy speaker of the House of Lords, presiding at legislation, debates, and questions. And in addition to all of these amazing accomplishments, she has written several books about caring, volunteering, and being an only child, and in addition to 2 novels about Jane Austen and her family. In addition to Jill, we are so honored to have 2 wonderful advocates from Carers UK. Helen Walker is joining us, and she recently joined Carers UK in December of 2018. From previous work, National Volunteering Charity at Time Bank, where she had been the chief executive for 10 years. Since joining Carers UK, she's focused on ensuring the financial stability and the growth of the charity in order to launch a new ambitious strategy in 2021. She's been appointed to represent carers on the National Health System Assembly in the United Kingdom, which is the body that's brought together to advise NHS England and NHS Improvement on the delivery of their long-term plan, as well as the National Institute for Health Research, School of Social Care Research Advisory Board at the LSE. Her extensive leadership experience and sector knowledge saw her create a well-respected and successful brand in her previous organization. She's also worked as a director of fundraising at a military charity and in the voluntary sector for over 25 years. So very, very excited to have Helen. And we also are honored to have Emily Holzhausen, who is the head of the Carers UK Policy, Parliamentary Research and Media Work. She's worked on many issues relating to caring, including employment, and was responsible for Carers UK advice and information services for 15 years, transforming that service into a wider digital offer. She has worked on 2 successful private member bills and numerous pieces of legislation which have introduced carers' rights. She also leads Carers Week, which is one of the UK's biggest awareness weeks involving thousands of local events, and established a Carers' Rights Day, which is now in its 19th year. Her heart is really in the research and evidence on family caregiving and how change in practice can benefit carers. She has undertaken over 40 pieces of original research into carers and caring, most recently delivering Caring Behind Closed Doors in April 2020, one of the first major pieces of research on carers globally, with a 6-month report due in October 2020. And I should also just mention that Emily has been helming research specifically on the topic of COVID-19 and caregiving. She is currently a co-chair of the Care and Support Alliance, which includes 70 organizations working for better social care. She's been part of the COVID-19 response in the UK and is on the Government Adult Social Care COVID-19 Task Force and a co-chair to the Carers Advisory Group. And she was awarded an OBE by Her Majesty the Queen in 2015 for her services to carers. I would also like to introduce you to Liam O'Sullivan, who is the Executive Director of Care Alliance Ireland and a longtime champion of our global work together through the International Alliance of Carer Organizations. Care Alliance Ireland is an award-winning alliance of more than 95 not-for-profit organizations which support family carers. His work with Care Alliance since 2004 has included bringing National Carers Week to Ireland, developing collaborative and impactful relationships with third-level institutions in family care research, and establishing an online family carer support group. He's been actively involved in global movements related to caregiving, including the establishment of Eurocarers, and most recently as a trustee and treasurer of the governing board of the International Alliance of Carer Organizations. His background includes qualifications in social work, youth and community studies, social research methods, and most recently implementation science. And he's particularly interested in good governance and bridging the gap between research policy and practice. And last but not least, we are honored to have the director of the French Association of Caregivers, Clémentine Cabriel, who will be talking today about the great work that they are doing in that nation and the work that she's been doing globally. She is committed to a strategic project on caregivers and has been working to bring caregivers into the public policy conversation and infrastructure in France as well as internationally. Before becoming a senior executive, she worked for nearly 10 years in human resources and management in Asia and then in France with local authorities, and studied politics and management while she was in university and at business school. So very honored to have such a wonderful panel of speakers. And with that, I will pass the baton to Jill to kick off our discussion.
Thank you very much, Grace. And it's a great pleasure and honor indeed to be here. You'll have heard that I've been around this business for 30 odd years, more than that, I fear. And I've been 20 years in the upper house of the British Parliament trying to be the voice for carers there. And it's a particular pleasure to me to come after Aisling's contribution, because if ever in those 30 years or 20 years in Parliament, I felt jaded or a little bit tired or felt, oh, we're not getting anywhere, I keep banging on about this issue and we're not getting anywhere, I only have to listen to a carer like Aisling telling us about her situation, and my passion is rekindled all over again. And I'm sure those are the things that we will all remember from this conference day. What I've been working on, what we've all been working on, as you know, as Grace has reminded us, is turning what was a private trouble, a private, almost a secret thing that happened in families and in neighborhoods, into a public issue. And doing that by gaining recognition for the carers And that's included getting numbers, and we've talked about numbers today and about the data that's so important in pressing the case. That's also been about campaigning for policy changes and about legislation to enshrine those changes in law. And we've had some success in that, though never enough, as we'll no doubt go on to hear. The pandemic has brought this public issue into sharper focus, not only for the increased caring activities that there have necessarily been, how dependent all health and social care services are on the unpaid contribution of carers. And that choice for carers, which we heard about from Stacey and from Aileen, has been absolutely non-existent for most carers who've taken up this caring role during the pandemic. But we can see the pandemic, I hope, as an opportunity to make that voice of carers even stronger, nationally and internationally. Lenny told us that caring has not quite punched its weight in terms of its size. And I think maybe that's right, but I do believe that the very size of our constituency, those millions, those even billions of carers, will drive the policy in the end. And talking of millions and billions, Lenny has also reminded us that it makes very sound economic as well as moral good sense to support carers. So I'm delighted we have such a strong and representative panel from Europe, from the UK, from France and from Ireland to discuss those issues further with you now. I'm going to introduce them in the order that Grace introduced them, though that may not necessarily be what you have on your program. And if they want to change it, I'm perfectly happy. But we have 4 of them, so let's get straight ahead. And I'll introduce first Helen Walker, the Chief Executive of Carers UK.
Jill, thank you very much. Whenever I'm reminded that you were once Chief Executive of Carers UK, I always feel wholly unworthy to walk in your stilettos. So I'm deeply embarrassed to be in this position. Could we have the next slide, please? Our first one, and maybe the next one. So I'm going to talk first, just very briefly on one slide, and then I'm going to pass over to my colleague Emily, who's going to give you some more detail on the research. But I wanted to give you a little bit of background about what's happening in the United Kingdom and how COVID has kind of impacted upon us. So we've had 61,000 deaths due to COVID-19. That's 903 per 1 million of the population, ranked 9th globally in terms of highest deaths. And I don't think that's a statistic that we want to be proud of. But what impact has that had for unpaid carers? Well, we estimate that there are now 13.6 million people caring in the UK since the pandemic began. So that's 1 in 4 of the population, which is up from 1 in 6. So for the purposes of the politicians, that's 1/4 of the electorate now are unpaid carers. And I think that's pretty powerful stuff. More people are caring since the pandemic began. In fact, there are 4.5 million new carers. And the majority of those carers are also juggling work and care. So we estimate that of that 4.5 million, about 2.8 million are new working carers. And it will come as no surprise, particularly after listening to our last speaker, that carers are telling us that they are stressed and that they are exhausted. Respite centres having been closed since March, they haven't had a break. They're fearful of the virus. They've had little or no support from regular sources like family and social care, meaning that they're practically, financially and emotionally kind of on the edge of breakdown. I think it's not overstating it to say. But as Jill just said, the awareness of caring is higher than ever before. So the question is this our moment? Is this the moment for a step change in caring? So what did we do at Carers UK? We worked very much behind the scenes with government and the NHS to ensure that carers were included in advice, in legislation, and were supported, or as supported as we could get them. And we created new initiatives to help carers quickly, constantly updating our website. We got funding to quadruple our helpline, literally overnight. At the peak of the pandemic, calls increased by 80% to that helpline. So it's absolutely vital that we were able to quadruple that as soon as we possibly could. I think we've seen that carer-friendly employers were without a doubt the best equipped for change, as flexible working and working from home, as we all still are, became very much the norm. Our statistics, our research has shown throughout the pandemic, the carers have been providing £530 million worth of care a day. So that's 135 billion since the pandemic began. It's just a phenomenal amount of money. It's absolutely extraordinary. And yet, as our previous speaker said, you know, we haven't seen an increase in carers allowance. We haven't seen any further additional support. And yet we've seen carers stepping it up on a day-to-day basis. We've seen the demand for information on our website increase by 600%. So hits to our COVID pages ramped by 600%. And it became the go-to place to get up-to-date, correct information, signposted to by government, signposted to by the voluntary sector, signposted to by local authorities. And so it was a huge responsibility for us to make sure that that was absolutely accurate, and we were updating it on a day-to-day basis. At times, 3 or 4 times a day, we were updating that. And what else have we done? We've developed new digital opportunities for carers. So Care for a Cuppa sessions, which is basically a Zoom call like this, allowing carers to meet remotely for peer support. Share and learn sessions, which another initiative which is focused on either well-being or having fun, something I think we're all struggling to have at the moment, or learning a new skill, a space just to take a break from caring. And actually, because it's online, many people are able to do that in a way that perhaps they couldn't face-to-face, because they couldn't get someone to support the person that they care for. Of course, our forum has continued to provide peer support, and forgetting those who are digitally excluded. We created Caring Caller. So we invited our volunteers, who usually do face-to-face work, to telephone the most vulnerable carers, just to check in on them and to make sure that they were okay. And we also made a point of physically writing out to all our members early on with the same kind of advice as to where they could get help, and our helpline number with the new opening hours, because we were very mindful that not everybody has access to our website. You know, we've still got something like 17 million people digitally excluded in this country. So it's absolutely vital that we have to create some sort of hybrid version of this extraordinary kind of online version of help and support. I'm going to pass over to Emily to talk through the next slide, which is all about the research that we've been doing during COVID.
Thank you, Helen, and thank you for the invitation to be here. It's absolutely wonderful to be amongst such distinguished speakers. So as Helen mentioned, one of the really, and Lenny did this morning as well, it was one of the really important things we felt early on was that carers wanted to tell their story, and stories were important, but equally not enough. We didn't know the size of the issue. And so we did this first report in April, and we found that, and we had a phenomenal response, 5,000 carers in such a short amount of time. It was extraordinary. We found that 70% were providing more care. We came back later, 6 months on, and did it again, and you'll see that care went up by 11%. And we were absolutely shocked. After a summer of more relaxed rules, we thought, would carers be feeling better? Would some of their services had returned? But if you listen to Aisling's story, which goes to the heart and soul of it, the things that people saw were removed were the services. We measured those so we could put a figure on it. They weren't back. As Aisling talked about as well, her mum had greater needs. And you can see there that 78% of people are caring for people with greater needs, which also will have an impact on how we come out of this. We have a population that has greater needs. And so all the calculations of the kinds of social care support that you might see, of course, don't work anymore. They need to be recalibrated and recalculated when we go forward. And some of the things that Aisling mentioned in terms of getting a break and worse mental health. We saw carers having to give up work as well. And one of the reasons why they can't give up work or return, because services aren't there. So in a similar way that we've argued about childcare in the past, We need to argue about care in the future, that a solid foundation for care really matters. But both of these reports have been really influential and very important in describing the challenges, putting a figure on the challenges, not just the stories of what carers have had to do. Could I have the next slide, please, Charlotte? So we've divided up these particular areas into what we did, and Helen has gone through some of the areas. Evidence from carers has been unbelievably important. Listening to carers, getting their insight through whatever channel they come to us and tell us. And as Helen said, not only did we use the advice from carers to advise others, but it also helped us to be on point with government, highlighting where we've got gaps, where we weren't addressing things, and to find solutions. Digital has been incredibly important, as Helen mentioned, with Jointly, and we've worked very closely with employers to provide evidence. The government has made some changes for carers. They relaxed some of the rules around the main carers benefit. That was very important in lockdown. They've fairly quickly produced advice and guidance, but we've found that we're able to be quicker. So if something comes out on the day, we can update our guidance immediately. The state support for carers who were unable to work was also incredibly important, and caring was a reason why they could get that. Being made key workers for testing gave carers the kind of recognition that they needed, and carers support was a priority for care funding. Our governments in different nations, Scotland, Wales and Northern Ireland, did different things, and Scotland has done more. It has given additional funding to carers, and that we have not seen in England, Wales and Northern Ireland. So coming out of this, as some of the speakers have talked about, we feel we need a new deal for carers. This is unprecedented times that we cannot continue in the way that we have been before. So these are some of the things at the bottom left that we're calling for: an increased carers allowance, paid time off to work for care. Other countries have this right in the workplace. When we talk about better recognition, that's everything from understanding caring right to equality and having equal treatment. So we want to see carers as the kind of treatment that gender equality, disability equality also gets. We want equality for carers and people without caring responsibilities. Of course, we need to see higher investment in care. That's going to be a challenge when all of our governments are in a situation where spending has obviously been huge on COVID, but we cannot go to the future with this level of caring. And finally, we need to listen to carers and we feel we need to use the opportunities to continue to innovate, whether it's those hands-on services or whether that's with digital. And that's something that, as Helen said, we will continue to do as an organisation. So I'll finish there and hand back to Jill, and thank you for listening.
Thank you very much, both Helen and Emily, for pointing out how very important statistics have always been in our work, never more so than at this time when governments themselves are completely overwhelmed with the statistics from the pandemic. It's very important to keep pushing those statistics about carers. And I'm sure that there will be questions for you at the end of this session. But we'll go straight on now to introduce Liam O'Sullivan, who's the Executive Director of the Care Alliance of Ireland. Welcome, Liam.
Thank you, Jill. I think it's always tricky being the fourth speaker. In this case, I'm the third, so I think I've dodged what we would call the graveyard shift. Happily hand that baton over to Clementine. I listened to Helen and Emily talk a lot about the statistics, and they're so important. And it struck me, I was doing a course a wee while ago, and a gentleman emphasized the importance of the hearts and the minds and using the stories of Aisling, who spoke so eloquently earlier. And I think we need both to affect change. And I would imagine Jill will concur with that. And the first slide will speak a little bit to that. I'll summarize it here. You'll have access to these slides later. Some stats there around the percentage of caring, and wouldn't you know it, literally last week that figure has been updated by our own National Statistics Office. They now estimate it's over 500,000, and about 1 in 8 adults provide care. So that's more in keeping with the European data that's emerging. We still have quite a relatively young population in Ireland, so I think that probably speaks slightly to the differential between Ireland, the UK, and indeed other countries. The ratio has incrementally changed so that bit by bit, somewhat more males are identifying as caring. It should be 40-60 there, so the figure is slightly incorrect. So it's still over 60% of women are identifying as caring. And it struck me, speaking to our colleagues talking about the African continent, I suppose I'm always conscious of the risk of the kind of ethnocentricity, Anglophone centric view sometimes we have and articulate. And I think we need to be more and more we need to learn more and understand more the perspectives of caring in the African continent, in Asia. And I'm delighted and looking forward to tomorrow's discussion as part of this wider World Carers conversation about that and the language of caring and how it evolves. One of the figures that's never ceases to amaze me is women in their 40s and 50s, that cohort of caring and that intensity of caring, often known as the sandwich carers. And the most recent data in Ireland is also suggesting it's kind of increasingly, it's going up as well somewhat. So it's not just in your 40s, but it's in your 50s and 60s as a woman. There's a really, really good chance that you're caring perhaps for an aging relative. And isn't that good? People are living longer, but also perhaps you're minding kids as they grow up. I suppose the final point I'd make is around on this slide, is around that so many people, as Emily spoke, and they've some really good work in the whole working carers, are juggling both the paid work and the unpaid. And again, the speakers from Africa talked about that, coming home from a day's work, but also being expected to provide a lot of that care. I'm not going to speak too much about COVID, other than to say in Ireland, at the moment, I think we've the lowest rate, but that's probably thanks to an earlier lockdown we had a month ago. So it's very much a movable feast. Thankfully, our mortality figures have been a lot lower. They're probably mid-range within the world, and hopefully they'll stay there or indeed improve. The next slide, please. When I was getting ready for this presentation, behind me you'll see some books to pretend that I actually read, but I don't really. But what I did come across was the Waverley Modern English Dictionary of 1930 from my father-in-law, and I just looked up the term care and how it was defined then, and I'll let you be the judge of if that's still relevant. And to care, to be anxious or solicitous, to be concerned about, to provide for, attend upon, to have affection, respect, or liking for. In our own language, we use the word curum for care, which is a nice, I think, a nice word to use. Some of the issues and I suppose the challenges I'll touch on now, and it's that piece of that research policy practice gap and what we call that implementation gap. We can have wonderful research, which is really important. We can have great policy, but we need much better practice, and we can never be, we can never stop campaigning and insisting on that. The second piece, and it's quite I suppose close to my heart, is that issue of the right to privacy. We've had the GDPR regulation, also known as the General Data Protection Regulation. And at one level, you could argue that people have the absolute right to privacy in respect of their health condition. At another end, and I suppose I'm on that spectrum, is from a carer's perspective, surely they have the right to talk about the person they're caring for. And through those shared experience that others have alluded to, get support, be it in a small support group, and perhaps indeed online, which is something that we've tried to do. And it's something we're going to stand up for and challenge. That absolutist narrow interpretation of privacy, I think, does no good to family carers and the legitimacy they have. They're giving their lives to care for someone. Surely they have the right to talk about some of those challenges, some of those arguably private matters, but matters that through peer support and through others' understanding, carers can feel less isolated, less lonely, more supported and better able to continue in their caring role. And won't that benefit the dependent person? The third part, and it struck me, Aisling mentioned that welcome to our world. Some of the feedback from carers through COVID was, this is my world. I've been living quite an isolated life. So in a sense, get over yourself. This is part of our world. So I think it has shown a light, but also brought to a much bigger part of our population the issue of caring. Emily and Helen spoke about Carers Week, and we copied their model and ran with it, and thankfully that's affected some positive outcome in Ireland, and it's something we still lead on. We need more than awareness, and I think everyone knows that, but it is probably an essential part of the picture to affect change. So it's finally the piece for me is I suppose the frustration about the slow return to services. We're 9 months in now in Ireland anyway, there hasn't been a return largely to respite services. To be fair, home care support has been largely protected, but the daycare, there's no direct, face-to-face care support groups, dementia cafes, all those, they're stopped. And I think that's not good enough. I wonder, does it speak to some of the state's risk aversion? Just in case. And the reality is, if by doing nothing, you're taking sometimes a bigger risk. And I think we need to be courageous. And I think, to be fair, NGOs can be more responsive, more nimble in pivoting. That's what we did as a small organization of 2 people. We set up an online care support group that's now supporting 2,000 people. We fed into guidelines from government that took a long time to come to fruition. We were able to feed back within 4 hours that there was no acknowledgement or recognition of family carers. And then it took them about another month to do something about it. But at least we were there. And I suppose the final dilemma sometimes is around as the vaccine emerges, the prioritization of carers in that. And I think the discussion is at one level, well, epidemiologically, carers aren't at risk and those they care for. Yeah, they're not, because we have shielded them, we have protected them, we have kept them largely safe. And isn't that great? But there's a feeling that in some ways, well, we're being punished for that. You're being told you're not risk, so you're not going to be up on that list of prioritization. And this isn't the time for recognition and acknowledgement. This is time to minimize death and harm. So it's a tricky one. And as an organization, we've struggled with, and I don't know, I think in the UK and Scotland, they've attempted to affect the degree to which family carers are prioritized in COVID vaccines. I don't know that there's an easy answer. Of course, we all want to minimize further deaths, but we can't forget about and can't leave carers behind anymore, because they have been to a large degree. The next slide, please. I think that the 3 calls to action in some way, I would say join the international carers movement, get involved. I've been involved together with Emily and others for years. There's plenty of space. We're a nice group of people. And as we're moving into a second iteration of the International Alliance of Care Organizations, there's plenty of opportunities to do good stuff. There's a global state of care report that's coming out in the new year, which I'm looking forward to reading about. Emily and our team is at the University of Sheffield are doing some work around capturing the numbers of caring across the globe, which is really important. The second point I'd make, I think, is the online stuff works. We've seen it. As we've heard, health and social care services have pivoted, and it has to be a big part of future care support. The reality is, of those 2,000 family carers that we're supporting, I would put my money on it that the vast majority never engage with face-to-face care support groups. For them, they're on social media, it's what works for them. And I think we need to be led by what works for carers, not what works for large institutions or for state-controlled bodies. Finally, I think the working and caring piece, it's not going away. And isn't it great that people can continue to work and care? And the evidence is it's a really protective factor in carers' well-being. So let's enable that happen more into the future. Thank you.
Thank you very much indeed, Liam. And it's a pleasure to introduce our 4th speaker, Clémentine Trabrière, who's the director of the Association Française des Aidants. And nous attendons avec impatience le point de vue de la France.
Thank you very much for the opportunity of speaking of carers and COVID. Next slide. COVID-19, the word of our president was stay at home, no matter how. And then in France, as you know, we are a really national and regalian country. What happened for the carers is that they has to protect people at home, no matter how. The first response were initially devoted to the sanitary sector with technical and administrative measures, and the carers were really not considered. You know, in France, every night at 8 p.m., there were people at the windows, and you know, they clap their hand to say thank you to nurses, to doctors, but never we talk about carers. So caregivers were a self-evident relay. As often in this first period of crisis, without mask, without hydroalcoholic products, they have to do. As the parents at home, they have to do with people with dementia, with illness. So it was considered as normal. But what we have to understand is that the experience of containment, the lockdown, is not the same wherever you live, how you live, how many money you have, how many persons you are living with. So in France, it was also the occasion to understand how complex is the situation, and the public services were very different in the north, in the south, west, east. And it was very, very difficult for carers to understand the contradiction between the national government, one measure, stay home, and the application in the territory. Also, as many caregivers took over from professionals who couldn't go to the home anymore, you talk about it. But there are a lot of psychological effects which generated medium-term effects on caregiver health, and also difficult of communication in family. So this period, the first period, was also the return of ethical questions about carers, what they can do, what they cannot do. And it was very hard for people. As our colleagues in UK, we had an explosion of our website, a lot of questions. For example, people were wondering if they had to continue to work or they had to protect their family and stay home. It was very, very hard. And actually, this crisis just revealed our fragility in France, the lack of communication, the lack of consideration of the homes. It has been years since we observed a lack of staff in medical, social sector, a lack of collective institutions like respite institutions. Also in France, we have more the culture of crisis, whereas the culture of prevention. And also this crisis show how complex were our political and administration organization. And as a matter of fact, what works during this crisis was the proximity and solidarity, and not the rules. Next slide, please. There were also very good things during this crisis. A lot of initiatives from actors to continue to have a link with the carers. For example, we have a Caregivers Cafe who started from April to let people and carers talk about their situation, about how they could continue their life. And there were also many local initiatives like psychological consultancies, or also really practical things. But what we can say, and when we can measure, is that the crisis has reinforced the subject of a triangulation between carers, the professionals of health, and the accompanied people. And it is very important now to work about this triangulation. So the crisis has also revealed, I told you, differences between the territories, in terms of support for caregivers. In some departments, there were a lot of things who were already in place, and some other territories there were nothing. Maybe the last slide, please. Thank you. What are the other opportunities and issues? At the national level, there were, prior to the crisis, the topic of caregivers recognition has been accentuated in France, and in November 2019, there were a national strategy for the support and mobilization for caregivers by the government. So as a result, in August 2020, they had a law relating to the social debt and the autonomy of people. This is really something strong in France. You know, after the war, there were what we call the social security with 5 branches, and who were separated, the handicap policy and the age policy. And the law of August 2020 has the goal to create a 5th branch of social security, which dedicated to the risk associated to loss of autonomy, regardless the nature of autonomy. It's very huge. And one proof of consciousness of our government is maybe in October the 2nd, there had the indemnization for carers for 66 days paid leave. It was the first time in France. Of course, there is the European directive, which is behind, but since we have a lot of hope in the consideration of carers in next year regarding this law and regarding the climate. But maybe, and to conclude, what we observed during this crisis is that carers' life, you said, they couldn't choose. They had to support their friends, their family. And the real subject is the time conciliation for carers. Conciliation, it means how they can move, how they can deal with everything in the society, and also how they can have a voice. When we say the voice, we had noticed during the crisis that as we were in an emergency place, there were no time to consult people, to let people talk, and it's a huge subject in our democracies, is how we can make the representation of carers, how we can respect the voice of carers during the crisis, of course, and also after the crisis. And I think it's really a great subject in France. Also, and it's going to be discussed next year with the autonomy law, it's the choice of society, the choice between liberty and autonomy and responsibility. It's very huge debates. And the last one, but not least, is that, as you said, there is an inequality of territory. I said it previously, but also there is an inequality of between people, a social inequality. And the subject is, are carers are going to be included in the society? Are we going to build a society with really social inclusion? Thanks for listening to me, and sorry for the English.
Merci beaucoup, and have absolutely no need to apologize for your English, Clementine. Thank you very much for reminding us of the profound effects and long-reaching effects that what happened during the pandemic may have on our movement. And I've been quite struck in the presentations about the agility that these organizations showed to step up, to make new arrangements, to fill in where governments failed, really. But the ability to do it swiftly and to do it responsive to the care needs, it seems to me, was tremendously significant and very impressive indeed. I should hand back to you now, Grace, I think, for some questions.
Yes, and this has been such a rich discussion. One thing I would say is we probably just have time for one question, and I'm actually going to pull from Facebook. And while I'm pulling that up, I would also encourage each of you in answering this question to think about, since this is the last panel of the day, what note of hope can you leave people on? You know, this has been such a challenging year for so many people around the world, and I think that piece of it is particularly interesting. You know, what is it that we can do to leave a note of hope? So one of the comments that was made on our Facebook chat was about this idea of role flexibility. And the commenter says that role flexibility is key to ensuring that a family is functioning and that it's achieving its objectives. And what I'd like to know, you know, that this person is asking, Jill, is really, you know, we've heard a little bit about that from country to country. And so role flexibility may look different from country to country, but there may also be common elements.
I'm sure indeed there are common elements. So let me come first to you, Liam, about that business of role flexibility.
I think in a caring role, you have to step up and down depending who you're talking to. If it's a family member, an extended family member who you're struggling with, if it's a healthcare worker. I think my message of hope is around collaboration, and either if it's at a macro level, individual level in your collaboration with the public health nurse, the care worker, to lift the person you're caring for, but also at an organizational level. Collaboration works, and we've seen in this crisis, organizations can pull together, work together, and be so and jump through those traditional bureaucratic boundaries that really didn't serve the needs of carers.
Yes, I think that business of how we brought about change so quickly, because it had to be done quickly. So that's a real message we've got to take forward. Clementine, would you like to contribute this point?
Just maybe one thing. We talk a lot about carers and work right now in France and competencies. And I think one of the major competencies of carers, of course, there is communication, there is soft skills, but one thing is very strong is the possibility of agility and to adapt. And nowadays in our world, it's really something strong. And they don't have to debate; they have to do. They have to do.
Yes. Now's the time for action. Emily?
I want to follow on from Clementine and say that I agree the time is for action. What we've seen in the UK government is that the provisions for carers have come later than others. As we've learned, they've gone along, they've gone, yes, they are critically important. And where we've seen services having closed, we've seen more people come now to local authorities, and we've seen increases in the health service. So I'm hoping that we'll take the learning and we'll do this collaboration is my note of hope.
And yours, Helen?
Always hard coming last. I think mine is that from a Carers UK perspective, next year we start a new 5-year strategy, and what I said to the board is we don't know what's going to happen in 5 years' time. I don't know what's going to happen in 5 minutes' time. So all I can do is have an ambitious direction of travel that is going to fundamentally change how carers are perceived in this country, and that is about equality, support, and recognition. And those are our 3 pillars as we move forward into the next 5 years towards our 60th anniversary. And so for me, it is about seeing what we have learned over the last 9 months and using that for fundamental change as we move forward. And I am hugely hopeful for carers. I absolutely believe that this is an opportunity for us. It is a burning platform, and it gives us the opportunity to make real change for carers and to make caring just absolutely normal and recognised and valued right through our society.
Well, I too think that we will look back on this year and say that was the time that things changed fundamentally for carers. And I think we will find about the faster way to meet carers' needs. And above all, we'll understand a lot more about the 2 C's, communication and collaboration between carers and between carers organizations in order to increase that voice, to make that voice as strong as we possibly can. And I have every confidence that we will do that. Thank you very much.
Thank you all so very much. And I know it's been such a rich panel, so much that we could talk about. And I will encourage people to continue to engage. I want to go ahead and turn things over to Jasmine Greenemeyer, who is the head of the Embracing Carers Initiative and the Healthy Women, Healthy Economies Initiative at EMD Serrano. And I am just so excited to have Jasmine as a partner, truly a partner in this effort. So Jasmine is going to close us out of our 3rd day of the World Carers Conversation. So Jasmine, please take it away.
Well, Grace, thank you so much. And thank you particularly to the last panelists as we thought about a potential path forward here. So as a member of Merck KGaA Darmstadt staff, we are the funder and convener of Embracing Carers, a global movement, to better understand and support informal and unpaid carers. But today I was particularly struck and just very thankful for Ms. Harmon sharing her story. And I thought very clear calls to action on how we can better support the emotional, financial, and healthcare system needs as it relates to carers and their loved ones. So thank you again for that. I do give Emily credit for I think my favorite quote of the day, that we need a new deal for carers. And as others highlighted, COVID, everyone has gotten an up-close experience to what it is like to be a caregiver, maybe for short-term, but many of us for long-term. And as someone said, welcome to our world. But I just really do want to thank the depth and the breadth of the conversations today. As it started around the political resonance of caring still is not proportional to the number of people giving and receiving caring. So I think we have another call to action as it relates to the potential there coming out of this crisis, as many of you have said. I particularly resonated around the cultural expectations around gender roles, but others highlighted the aging population, the pressure on systems, and the importance of public-private partnerships. But I love this last panel and just how we've seen world over the NGO response and just how swift and comprehensive it has been locally and regionally. But obviously we want it to be a more public-private partnership. So as Grace alluded to, please join us tomorrow as we go to another region, the Asian Pacific region, and hopefully have some fantastic dialogue there. But please continue to join us in 2021 because we also want to continue this dialogue for action. Thank you again. Cheers.